Hello and good morning to everybody here in person and everybody virtually. It's wonderful to have you all here for our first conference today, and it's called Navigating the System. The reason why we've put together this conference is that we've realized that all of us deal with very, very similar issues in different ways. We have some survivors who are navigating the system both in terms of the treatment but also the legal system. We have the treatment providers who are navigating the survivors as well as the legal system, and of course we've got the legal system that has to deal with everyone as well. So we thought it would be an awesome idea to come together, bring all of us together, discuss what best we can do for everybody involved. My name is Jellinek. I am senior counsel at Gluckstein Lawyers, specifically at Jellinek Ellis Gluckstein, and I have been doing this kind of work for my whole career, about 26 years now or so, and my team here does pretty much only this work. There's one or two little files that we have that aren't sexual abuse files, but most of them are in fact sexual abuse files. Most of our files are historical in nature, but we also do have present day assaults. We have been involved in cases involving pretty much every institution that you could possibly imagine that deals with children. Everything from the federal government and the residential school cases, all the way down to your local coach at your local soccer team and whatnot, and everything in the middle. Foster homes, schools, absolutely everything. I want to thank you all for coming. It shows really wonderful societal commitment to this very important issue, and we hope that in bringing us all together, we're able to navigate the system in a way that is most beneficial for everybody. We hope to do this conference more than once. We are looking forward to hopefully planning out a second one next year with different speakers, different topics, all of that. A little bit of housekeeping. For those of you here who can't see the board in front of us, the Wi-Fi login is conferenceguest@triovest.com. Triovest is TRIOVEST.com, and the password is all caps Triovest at small caps A 2022 ! There are bathrooms on this level just outside the main doors and to the left and then to the right. As well, feel free to partake in some of our munchies. We've got breakfast type munchies out now. We will have pizza for lunch, and afterwards we're going to have a short little get together downstairs in the main office. We'll have a little bit more munchies, a little bit of wine, things like that for those of you who wish to stay. It's absolutely not mandatory, but if you do wish to stay, please join us there. My first guest that I'm going to introduce is Jesse Frolick. Jesse received his Bachelor of Honors at U of T, and where he studied history and sexual diversity. He also attended the University of Strathclyde in Glasgow, Scotland, which happens to be one of my favorite cities, and he graduated with his law degree from there. When he returned to Toronto, he did some work with employment law and landlord-tenant. He's also done a general personal injury articling experience, and now he works for us and exclusively does sexual abuse work. And he is he's one of the rising stars in this area. So please Jesse, come on up, and he is going to talk about Through the Looking Glass: Vicarious Trauma in a Modern Post-COVID World. Thank you.
Thank you for the introduction. So I understand that I'm probably not the name you're seeing on your program, but unfortunately, Daniel P. was unable to attend today. So we said, okay, we'll find the next best thing. That person also not available, so I will be speaking instead. So we're going to begin with a little video that will just introduce what vicarious trauma is. And then we'll go over some different resources and tips and tools that we can use as organizations, but also as individuals to deal with vicarious trauma.
Helpers that are exposed to others' traumatic experiences can suffer a very distinct impact, known as vicarious trauma. Different from burnout or compassion fatigue, vicarious trauma can significantly transform our worldview and disrupt our perceived meaning and hope. Experiences of trauma are inherently without choice. When we are exposed to this, our own sense of choice, control over change, and confidence that we can make a difference can be completely altered. Vicarious trauma may not deplete our energy, as burnout does. However, it may deplete or distort our sense of purpose, efficacy, and meaning, often to one extreme or the other. For example, we may have feelings of confusion or apathy about what is important. We may feel persistently on edge with anxiety, guilt, or helplessness, or we may have an overinflated sense of saving the world. As helpers, it is vital for us to recognize vicarious trauma and get support to stay healthy.
Okay. So the first resource that I wanted to discuss was regarding what we can do as organizations, employers, or workplaces to help mitigate the effects of vicarious trauma. So the Office for Victims of Crime at the United States government has created what they're calling their Vicarious Trauma Toolkit. And this is available online, and there's more resources available as well there where you can find different tools that you can use to implement within your own organizations. But they've got 5 main strategies and areas that we can discuss. So the first is leadership and mission, where they've decided that to address the impact of vicarious trauma, leaders and vicarious trauma-informed organizations proactively integrate strategies into their workplace values, operations, and practices, maintain a clear vision that supports and articulates the mission of the agency, and regularly models and promotes open and respectful communications. So what research literature tells us is that these tools and good leadership can sustain staff by anticipating and responding to staff's needs, showing appreciation, and creating safe and open forums for their staff for communication. Advocates who received more support from supervisors and work teams also experience lower levels of secondary trauma stress, which is very important, and that's really what we're here to do. And that open and transparent communication regarding their organizational mission and their strategies and the implementation of their policies and procedures provides a strong foundation within the agency or organization. The second area is management and supervision. To fulfill the obligation to lessen the impact of vicarious trauma, managers and supervisors in vicarious trauma-informed organizations foster supportive relationships that are based on inclusivity, mutual respect, and trust. They'll promote policies and practices that lessen the negative impact of the work, and they seek out and support staff following critical or acute incidents. With quality supervision, staff will feel safe and respected, and it allows them to overcome high workloads and stay on the job. The third category is employee empowerment within the work environment. To promote and maintain healthy work environments, vicarious trauma-informed organizations will foster teamwork, encourage collaboration both within and outside of their organizations, create formal and informal opportunities with staff to connect with one another, and offer opportunities to diversify job tasks. Research literature tells us that positive work environments provide quality service outcomes and decrease staff turnover, but also helps to reduce the impacts of vicarious trauma. The fourth category is training and personal development within the organization. So to strive for professional competency, capacity, and staff retention, vicarious trauma-informed organizations promote continuing education, professional development, and networking opportunities through ongoing orientation and ongoing training. Research literature tells us that being trained in vicarious traumatization benefits both participants and the populations that they serve. And finally, staff health and wellness. To maintain the health and wellness of staff, vicarious trauma-informed organizations recognize the links between health, wellness, and staff satisfaction and productivity, and they'll devote time and resources to promoting well-being and encourage and provide health and wellness activities and incorporate those activities and ideas into their policies and practices. So research tells us that mindfulness programs increase compassion satisfaction and decrease compassion fatigue, which is one of the main issues that occur with vicarious trauma. And lastly, I wanted to talk about a few ways that as individuals we can manage vicarious trauma. So vicarious traumatization can lead to long-lasting psychological effects. It can affect many aspects of life, such as one's view of the world, spirituality, professional, and self-identity. In addition to identifying the symptoms of vicarious trauma, it is also important to understand the management of it. So different ways to combat vicarious trauma. While vicarious trauma can feel overwhelming and exhausting, there are small steps that you can take to feel better. First is spending time with people you love. Surround yourself with people who make you feel good. Plan an activity with friends that can distract you from thinking about your work. You can take care of your body. Spending time moving your body and eating well can help you feel better when dealing with vicarious trauma. It's important to also prioritize rest. Resting is productive. During days off, make an effort not to check emails, not to check in on patients. Do something that makes you feel like you. Reach out to your mentors. Debriefing with those in your professional circle can be a powerful way to process traumatic patient stories. Reach out and connect with your coworkers to debrief after your meetings with patients. Practice feeling your emotions. Notice changes in your body after you hear a traumatic story. Are you tensing your shoulders? Do you feel a pit in your stomach? Experience these sensations, acknowledge them, and then let them pass. It is also important to notice the good. When something good happens at work, write it down. Identify and celebrate the positive parts of your day, no matter how small they may seem. Feeling gratified when helping others protects against vicarious trauma. It's also important to shift your perspective. When you notice that you're blaming yourself or that you're feeling down, stop yourself. Instead, shift your thoughts to something that's positive about the situation. If you find yourself focusing too much on one patient, think about other patients and situations where you felt proud or accomplished by the help that you gave them. So there are a few cognitive behavioral therapy techniques that can assist. An inevitable component of vicarious trauma is experiencing a profound shift in worldview. This change in how we see the world can be positive, neutral, or negative. When we undergo a negative change in our worldview, we may begin to think more pessimistically or cynically about ourselves, others, and the state of the world. When we think negative thoughts, even when that thought is not supported by evidence, we end up feeling negatively. By identifying and challenging our negative thoughts, we can help ourselves feel better. Cognitive restructuring is a technique used in CBT. It asks us to identify negative thoughts and then challenge the evidence supporting that thought. A thought record can help us identify a situation where we're feeling negatively, followed by a thought we had in that situation, the resulting emotion, how we behaved, and how we might reframe or challenge that initial thought. So an example of that, of what a thought record might look like, could start with the situation of having your boss send you an email asking you to stop by their office to have a conversation about something. The thoughts you may have at that time is that you might be getting in trouble, you're going to get fired, or any other worst case scenario. The emotions that you're feeling at that time could be anxiety, stress, and potentially anger. When you look at those behaviors, you might put off replying to that email and delay seeing them. But the alternate thought that you could look at is that there could be other reasons why your boss wants to see you. At the end of the day, it's about reframing the way that you think about a situation and acknowledging the emotions that you may have attached to it, but recognizing as well that it's not necessarily the worst case scenario. So it's something that I think would be great for anyone to give a try the next time they are feeling negatively about a situation. Thank you very much for listening to me speak today. And I will pass this back to Simona.
Thank you, Jesse. That was great. One of the things that I just wanted to add is that vicarious trauma can also be experienced by lawyers and by survivors, because a lot of survivors will talk to other people who are also in a very similar situation, and that is, those techniques are important. And I can tell you absolutely without a doubt, by personal experience that lawyers do, in fact, are not bulletproof, and we do experience vicarious trauma as well, so it's very important for us to take care of ourselves as well. The next presenter is going to talk about record creation best practices for healthcare professional and supporting survivors. This is a very, very important topic for any of you who are treatment providers, because it'll make or break sometimes your client's legal case. Presenting that topic will be an associate here at Jellinek Ellis Gluckstein, Ivana Iwasaki. Her personal injury practice is focused on representing survivors of sexual assault, childhood sexual assault, sexual harassment, revenge porn, which is a newer thing that we're doing, invasion of privacy, and of course institutional abuse. I have known Ivana now for quite a few years. She's worked with us for 2 years, and I can tell you that she is a very compassionate, practical, and relentless advocate. She really does hope that survivors that are seeking justice through the legal system will have some benefit from her, and she wants to be a part of that. Thank you. Ivana?
Good morning, everyone. So as Simona said, my name is Ivana Iwasaki. I'm an associate at Jellinek Ellis Gluckstein Lawyers, which is the practice group at Gluckstein Personal Injury Lawyers that primarily focuses on sexual abuse and sexual assault claims. So this morning I'm going to be talking about record creation best practices for healthcare providers. So this is some insight that we want to offer to healthcare providers, as well as provide some context for why records can be critically important to survivors as they engage with any sort of justice process. So while the focus of today's presentation is on our advice that we'd like to give to healthcare providers, which includes things such as medical, mental health, and other healthcare providers, we also want to provide some advice and context that will support survivors in being their own best advocates as well. The primary focus of today, like I said, is what clients need from providers and how records can help them in the justice system, to put it succinctly. So, to get right into it, why are records so important? As part of the litigation process, we as survivors' lawyers often request records to support both liability, which is whether or not something has happened and whether somebody is legally responsible for that thing, but primarily to support claims for damages, which is how much a claim is worth, which is actually another way of saying the consequences somebody has suffered, often from a traumatic event. Before I begin with the recommendations for best practices when creating records, I will provide some background context on what it is that we as civil lawyers do when we, so to speak, carry out a lawsuit. Liability first. In civil cases, liability is the term used to mean when someone or something is legally responsible for something that happened. In order to prove whether or not somebody is liable, we also need to prove that something has happened. Often the only people who know what's really happened are the survivor and the abuser. Thus, for most survivors, their own witness testimony is the main form of evidence we have to support what happened. When this is the case, corroborating evidence therefore becomes critically important. Corroborating evidence is a term that means anything that confirms what a survivor says is true. Some common examples of corroborating evidence include a photo of a sports team that shows the survivor's teammates from that time, the layout or plan of a school or daycare center confirming where the survivor had classes or was held for care, travel records confirming trips occurred on certain dates, of course, emails or text messages confirming that the survivor and the abuser met on certain days or talked about certain subjects. A lesser known but equally important example of corroborating evidence is evidence of consistent disclosures made by the survivor over the years. It is common sense that it's easier to believe someone is telling the truth if they've been saying the same thing over and over again. This is where records can become critically important to support liability. Records can help survivors prove that what they say happened by providing important corroborating evidence showing that they've made consistent disclosures over the years. The second part of a civil lawsuit is what we call damages. Damages are consequences to a person. They are the harm caused by somebody's illegal actions. In the category of lawsuits, which we lump together as personal injury actions, Damages or consequences often come from a traumatic incident someone went through. To understand damages in cases of sexual abuse, it's helpful to illustrate by comparison the sorts of damages that are sustained where a physical injury occurs, as opposed to in sexual abuse cases, where a large part of it is often psychological, although we don't set aside that there are physical damages that can occur as well. In many physical injury cases, the trauma is straightforward and often a single incident. For example, a broken arm, a slipped disc, a torn ACL. The consequences of these sorts of traumas are often easier to spot. You can see them on an X-ray or an MRI. They have specific treatment plans: surgery, physiotherapy, chiropractic intervention, other things. When a broken arm is healed, you can see that it's no longer broken. When a slipped disc has gone back, you can see where it's gone. When a torn ACL is corrected, you can tell somebody has regained strength in their leg. And it's easy to measure and assess the long-term consequences. You can see how high someone can raise an arm, or how fast they can run, or how much they can lift. In these sorts of cases, there is a distinct before and a distinct after. In the cases of survivors of sexual abuse, the consequences, again, not setting aside that there can be physical damages, are often psychological harm. While it is well documented that psychological trauma does affect the physical body, from changing the brain structure to affecting your heart, your muscles, nerves, digestion, and even your bowels, the most common consequences to a survivor is emotional and psychological damage. We know that survivors experience things such as PTSD, post-traumatic stress disorder, anxiety, depression, dissociative disorders. And we know it can affect the brain structure as well. Traumatic events cause structural changes in the brain that correlate to things like behavioral changes, such as changes to working memory, behavioral control, emotional processing, executive functions, attention, abstract reasoning, intellectual impairments, and the list goes on. So how do you measure psychological harm? They're not like a broken arm. While science has come a long way and is now starting to detect those structural changes in the brain caused by trauma, measuring psychological harm remains a blend of science, observation, and professional experience. When there is psychological damage, you're now measuring the speed at which someone gets tired, how often they get activated, how difficult it is to focus, how easily they remember new information. And how do we determine which trauma caused the harm? Life is complicated. The impact of life on people is complicated. It's hard sometimes to tell which stressor or which event caused which harm. In this ways, survivors of sexual assault face a really unique challenge in proving the consequences a trauma has had on them. This is where records become important to damages. They are important to any personal injury action, but they are especially important for survivors going through the legal process. Healthcare records show the before and the after. They help support what a survivor is saying is true again. They can show that a survivor is tired more easily, does get more anxious, gets more angry, is less assertive, is more suspicious, is less careful with their own safety, more easily overwhelmed. These are things that won't show up on an MRI, but will show up in healthcare records. That's why healthcare records can be critically important. So first I will start with tips for records creators. And we have two pieces of advice that we've put up on the screen here. The first recommendation that we give to healthcare providers is to take a complete history and to take them yourself. It should go without saying that healthcare providers who are fully aware of all the things affecting their patients are more capable of treating their patients. Trauma, and especially sexual trauma, affects a treatment plan. As a healthcare provider, you will be doing yourself a disservice if you don't know the full scope of the trauma that you're dealing with. It's also important that you take a history for yourself. As a healthcare provider, relying on records from other providers can draw your attentions to things and can assist you in asking the right questions, but if not used carefully, they may lead you astray. We've had documented examples of doctors using old histories and writing down the wrong information, which then gets repeated throughout clinical records. This can do a disservice to a client or a survivor who is trying to explain that one source of trauma is what's affecting them. Take your own histories to be sure you are fully informed. If you suspect anything, ask gently. Don't press for disclosures. Let the survivor lead the conversation, but let them know you are open to hearing about it and helping them recover. Remind them it's not their fault, even if the healing has now unfortunately become their responsibility. The second major piece of advice we want to give is to document any disclosures. One of the best things records can do to support survivors in proving their version of events is by containing a record of disclosures that a survivor makes. Documenting disclosures is one of those pieces of helpful corroborating evidence. This is for a few reasons. First, it creates a new record of the survivor's story. Each record of a survivor's story can be very helpful if each version contains the same facts. It's thus important not only to record a disclosure, but to accurately record a disclosure. Pay attention and write down what the patient is saying. If you think you've misunderstood, make sure to clarify. This goes a long way to supporting that the survivor has been telling the same story in many different venues, which is one of those pieces of important corroborating evidence. Second, it can create a record that supports the survivor's memory of their healing journey as well. It's logical that if a survivor can accurately recall to whom they disclosed, what they said, and when they said it, it's more likely that they can accurately recall other events that happened in their lives. In this way, it becomes a secondary piece of important corroborating evidence. As is common with most times advice is provided, there's also a list of some things we recommend not doing for healthcare providers. Here's a couple of examples. We recommend that healthcare providers don't provide a prognosis in their records unless asked to do so. This is important because if a healthcare provider wants to create a treatment plan, while admirable, it needs to be a full scope, nuanced, and integrated approach that's taken. We have seen healthcare providers who provide prognoses in a standalone fashion that often don't help the survivor as much as they hope that it might. Second, don't diagnose unless you're equipped to diagnose. Different healthcare professionals are permitted to do different things. Some are permitted to diagnose, some are not. Not all healthcare providers can diagnose mental health disorders. Third, be cautious when drawing conclusions about where the trauma originated. This is different than recording what a patient says is their belief of an origin of a source of trauma or an issue that they're facing. Recording that is different than drawing your own conclusion. For example, if a patient has made a disclosure to you and is describing symptoms that they're now experiencing, such as depression, anxiety, heightened irritability, it can be a disservice to the survivor to say they're having a difficult time at work. It can really minimize the trauma that the survivor is trying to express to you. Now we've come to the part of the presentation where we'd like to equip survivors a little bit to be their own advocates. We have two big pieces of advice we would like to give to survivors who are either starting or thinking about starting their healing journey, or may even be along it already. First, we recommend that survivors record names of treating mental health professionals especially, and their contact information if easily available. While there are not as many resources as we'd like out there, there are some free resources that survivors are able to access, but these might be short-term resources. So often you'll see a therapist or a counselor once, twice, or 3 times, but not be able to establish a sufficient treatment relationship with them due to lack of funding, ability, and so on. It's important to record the names of your treating mental health professionals as you go through your journey, so that later on, if you need to go back and check something, we have that information available to us, as do you. Second, be clear about what you want from a healthcare professional. You're allowed to tell them what you'd like them to record in their records or what not to record in their records. A reminder that all healthcare professionals do have their own duties, obligations, and best practice advice about what they may need to record or chart, but you are permitted as a survivor to set boundaries about what you would prefer them to record or not to record. And don't worry if you're not able to speak up just yet or aren't ready. Just know you can when you are ready. And at the end, we'd like to give a trauma-informed caveat. First, a reminder that disclosing and seeking treatment is incredibly hard for survivors. When a survivor is ready to start their healing journey, it's an intensely unique, difficult, and emotionally fraught process. It can be an up and down process, a hiccuping process, it can be linear, it can go on pause for years at a time. When a survivor discloses to a healthcare professional and they're prepared to seek treatment, be patient. It takes time to be ready to be all the way there. Second, a reminder to believe your client. It's best to take the approach to believe your client right at the outset. Respond to them in an empathetic and non-judgmental way. Many survivors never report sexual or intimate partner violence or seek services because they're afraid they're not going to be believed. As I just said, it takes a great deal of courage to seek services and support. As a healthcare provider, it's imperative to let your client know that you believe them. A reminder that it's not their fault, and to remind your clients that it's not their fault either. We have often had clients who express a lot of guilt, humiliation, anxiety, self-loathing. It's not their fault. Reinforce that the violence is not their fault either. No one asks to be assaulted or abused. The assailant is responsible for their violent behavior, not the survivor. A reminder that memories as well can be difficult. While we've recommended that you document disclosures to assist a survivor, it's important to remember that not all survivors will have good memories of abusive events. Memories are a tricky thing that way. Sometimes memories take time to come back or form into something cohesive. Sometimes they stay as shattered fragments. Thus, the last piece of advice we would like to provide you is always a reminder to remember that survivors are doing their best. Thank you.
Thank you, Ivana. That was very informative. Having done this kind of work for as long as we have, I've got one other piece of critical advice when it comes to record taking, and that is, please do not record what it is that lawyers tell their clients. We have seen records that say, patient says lawyer thinks the case is horrible. That's very, very bad. What's even worse is patient says the case is worth $12 million. Also, again, not what you want to see in a record. So anything that a patient tells you with regards to their legal case, we would ask that you do not write down, because oftentimes survivors may believe certain things, maybe at some point we have said certain things, but that is not by any means something that is appropriate in your record. So please don't do that. The other thing as well is that I wanted to mention along the lines of corroborating evidence. We had a case many years ago where defense counsel absolutely refused to believe our client, just did not think our client was telling the truth because there was no history of disclosure, this, that, and the other thing, and it was a horrible matter. And what happened was that in one treatment record that was created 12 years prior to the case, there was one little mention of the sexual abuse. Client says he was sexually abused by big brothers when he was a child. That was it. That is what absolutely changed defense lawyers' mind on whether or not our client was telling the truth. So that kind of note taking is very, very important. The one thing that I want to say to survivors, honestly, is that your relationship with your healthcare professional, as well as your relationship with your lawyer, is something that you have to feel comfortable with. And sometimes you may meet somebody and they may be the best therapist in the world, you just don't click with them. See if you can find somebody else. That's very, very, very important. That also goes absolutely with your relationship with your lawyer. So next, we have a break. We have a break until 11:30. So we're going to be on break until 11:30. As I said, there are refreshments in the hallway. For those of you at home, please take this time to go to your refrigerator, walk your dog, all that. So we'll see you right at 10:30. Thank you. Hello and welcome back. We are starting in on our next panel, which is the healthcare panel. And moderating the panel, we have Diana Harris. Diana is a social worker, and she was a lifer with the LIN and whatever was before the LIN, which were several incarnations of it, and dealing mostly with long-term care. She recently joined us about a year ago or so, and Diana specializes in our intake, and she's one of our first contacts with our clients, and she puts them at ease and makes their journey that much better. She will be moderating the panel, and along with Diana, we have Dr. Gail Robinson. Dr. Robinson is a professor of obstetrics and gynecology at the University of Toronto, and she co-founded the mental health program at U of T. She has a special interest in the psychology impact of various aspects of women's reproductive cycle, as well as sexual violence against women, including, of course, sexual assault and sexual abuse. She is a renowned expert in this area when it comes to psychological impact assessments. We also have Sukhpreet Kainth. She's a nurse at Women's College Hospital. She is an advanced practice nurse with the Sexual Assault and Domestic Violence Care Center at the hospital. She has unique expertise when it comes to the nursing team at the Sexual Assault Center, and is very interested in providing patient-centered care to survivor and gender-based violence. So I will have Dr. Robinson start with her presentation, I believe.
Thank you, Simona. So I'm primarily a psychiatrist. I'm cross-appointed to obstetrics and gynecology because of my work with women. And I have done a lot of work as an expert witness in sexual assault cases, going from residential school abuse to pretty much every medical or paramedical profession, lawyers, teachers, Boy Scouts. Never put your kid in the Boy Scouts. I've had a lot of experience doing this. But I thought I'd explain what an expert witness does, because a lot of survivors will be referred to an expert witness. And this goes to the talk that was given by Ivana about the damages. How do you assess damages when it's not just a matter of an X-ray or a fracture or something like that? Let me just talk about this. Okay, so what you're looking for with an expert is somebody obviously with some experience and knowledge of the consequences of abuse. You want somebody who can write a nice clear report and can pull together all the various facts that they're presented with. It's useful, so I'm a psychiatrist, so I can make a diagnosis. And it's also important to be aware, because you're going to be asked for recommendations as well, so to understand about treatment options, and be willing to testify. So there are a lot of people who are very knowledgeable, but the idea of coming into court and testifying is terrifying. It's actually quite fun. And as a psychiatrist, we're used to looking for what's the issue behind what people are saying. So I think we're generally pretty good at cross-examinations, because I know often where they're trying to lead me, and what they obviously try to do is lead you into a place where you're making a ridiculous assertion. So that's a good idea. So what we start with is, what is it that they're looking for? And then we do review of all sorts of documents. So as many things as we can find about school and work and health, counseling, interactions with police, even their income tax, so that we're trying to get a sense of everything that's happened in this person's life, even before and after the abuse. We then meet with the client, and that's a pretty lengthy interview, so at least probably about 3 hours, if not more, and then prepare a report. So what are our goals? We're trying to understand, who was this person before the trauma, what was the nature of the trauma, and what were the effects of the trauma. So before the trauma, we want to find out generally what were they like, and that obviously depends on their age. So if you have a young child, it's, there's not a lot of information, but you glean whatever you can. If it's an older person, you're going to get more information. But we want to look at how they functioned. Were they working? Were they in school? What about all their relationships? What kind of a person were they? And did they have difficulties with their mental health even before this happened? We want to know about their sexuality and how that's been affected, whether they started abusing substances either before or after this happened. What about their financial stability? Did that change after the trauma? And what about their vulnerabilities? And this is very important because you don't want the person coming to you to assume that they have to pretend that everything was perfect before this happened, because very few people have perfect lives. And what they need to understand is that I'm not going to say, oh, well, you had terrible parents, so that was clearly the only thing that affected you. What I like to think about is kind of a domino theory. So if you had even, genetic issues, so in your family you had histories of substance abuse or whatever, but what triggered it in you? You were vulnerable, and then this trauma happened, and that really turned things on. We want to know about the nature of the abuse, because there are different sort of effects. Was it a violent assault? Was it a kind of seduction? And seductions, especially with children, are tricky because, then people feel guilty because, it may have felt nice at the time, or they may have been given presents. And it's very important, as was said before, that you make clear that as a child, you're not able to assess that this is really a bad thing. You just go along with what's happening, and it may be only later that you realize, oh my God, this, I shouldn't have done this. So people can take advantage of that innocence as a child. And it also varies with who's the offender. Was it a stranger or a family member or a trusted person or somebody in a position of power in some way? So the interview, as I said, it's confidential. It's, the report obviously goes to the lawyer, but no one else sees that information. And we're going to find out about all these kind of things, about the family dynamics, the previous functions, how and when the abuse has occurred, and what has happened since. And have they had any benefits from treatment, or some people have never had any treatment. They've sort of sat on this for years and years, and then finally something triggered them to come forward, but they've never had any treatment to deal with it. So my job is to construct what we call in psychiatry as a formulation. Why it happened, what were the preceding and predictive factors, what were the things that turned things on, and what I see as going ahead. So I am in a position to try to make a prognosis in this kind of situation, and make a diagnosis and make treatment recommendations. So the client, what they need to do is be honest. There's no point in pretending everything was fine until this happened. That actually doesn't help them, because then something can come out and then they look as if they're lying. So it's better for me to know all these things, and then I can use them, because you don't have to be a perfect person before something happens. Who you were before is also going to affect the impact of what happened. It's also very important to remember that a good expert is neutral, because I don't want them to think I'm a homer and I'm just going to, make it look as if terrible things have happened if they haven't. I'm going to be truthful and, would say to them that I will write the same report whoever hires me. Now, quite frankly, that's sometimes different. Because in the sense of sometimes I'm asked to review the report of the expert for the defense. And I tend to find that most experts for the defense really tend to jigger their reports. I remember one report, this poor woman who'd been, she was from a native reservation, and she had been terribly abused there and then put in a foster family where she was abused again. She had multiple suicide attempts and was really struggling. She was just about 19 years old. And in the expert report for the other side, they said, well, we don't expect much from Native people anyway. How could she have a good outcome anyway? So sometimes it's like shooting fish in a barrel to comment about those things. As I said, we don't expect them to be a perfect person. We're not going to twist the evidence, but we really are going to try to look at how this has impacted you, how it's affected you in all sorts of ways. You know, we talked about mental health, but you know, how it affected you with substance abuse, with your sexuality, with your work, with your moods, with your ability to go for help. All of these kind of things we're looking at. So that's just a brief summary. I thought it'd be helpful to let you know what our role is in this. I also see patients, but that's a particular kind of thing. So thank you.
Absolutely. Yeah, okay. Hi, everyone. So I have a few questions for our panelists, and I'll start with some general questions. Either one of you are welcome to answer, and then I'll ask specific questions. So can you tell us about the services that you offer to survivors?
So I am from Women's College Hospital. And in terms of the services that we offer to survivors, we will provide sexual assault and domestic violence to anyone who has been sexually assaulted within the last 30 days. And then when it comes to intimate partner violence, if they are actively still in the relationship or if they left the relationship within the month, we would still see them. So you're probably wondering why there's that time frame, right? And so with our program, we are a very acute care center. So we respond to patients who have experienced acute trauma. So unfortunately, we don't see historical sexual violence, but we will see anyone who has been recently sexually assaulted, and we will provide them medical and forensic care.
You know, as a psychiatrist, we see people who may not present with abuse, but present with depression or whatever. But as we take a history, it comes out that they have been abused, and so that becomes maybe a focus of the treatment of how that's affected them in the long term.
And what sort of challenges do survivors face when accessing health care from your experience?
Well, I think the main thing is being able to find people who are willing to deal with these kind of issues, but also a financial issue. You know, psychiatrists or there are also GP psychotherapists. We get covered by OHIP, but psychologists or social workers, you know, don't. So they may have expertise. And if people work for a firm that has some sort of insurance that allows them certain visits, they can go. But otherwise, it can be tricky finding somebody who can look after them.
Yeah, absolutely.
So in terms of for our program, some of the things that I have seen patients, you know, experience a lot of challenges is actually just coming forward, right? So imagine right after an assault, the patient wants to do a police report. They know that they need to come in for forensic evidence, or they need to have some safety planning done. That could be very, very difficult for someone to just show up at the center, right? Sometimes it can feel intimidating also going into a hospital. So our program, we respond to emergency departments as well. So even patients wanting to come into an ER and telling the triage nurse, for example, what happened, how is that person going to respond to them? That is huge, right? Mm-hmm. So those are some of the challenges that I find that patients do face. Sometimes there's concerns around being victimized or being blamed for the assault. They might be experiencing shame. They might have concerns around their status, or maybe feel that, you know, if they report to police or if they come forward, will they be judged? Will they actually get charged for something? So very, very common and it's reasonable to feel that way.
Right, of course.
And there may be ethnic issues as well. Mm-hmm. You know, if you come from a background where if you're abused, you're seen as sort of having lost your status and the family's ashamed of you, it's very hard to come forward and talk about this.
Absolutely.
Yeah, for sure. So, in your experience, what is a survivor's healing journey like? Is it linear? Do they all need the treatment plan, or do they vary depending on the person?
You know, I think every treatment is dependent on the individual. But you know, it certainly isn't as simple as saying, well, you know, you were abused when you were a child and it wasn't your fault, and so go forth and be free. People can still struggle with guilt, and they can make progress, and then something may, you know, once they've opened up the floodgates, something may trigger more emotions and they kind of go backwards. Sometimes they need medication because they could get very depressed when talking about these kind of situations. So I don't think in many cases it's exactly linear. And if a lot of time has gone by, that makes it more complicated. If people can get help right away, you know, you can work on some of these guilts and all these things right from the beginning, and so they don't get stuck in cement.
I completely agree with Gail. I don't think it's linear, and again, I can't really speak to like a diagnosis piece or anything like that, but just from experience, what I have seen from patients is that it's not linear, right? There's almost like ups and downs, and it's continuous, but it's slowly going up. The one thing that our program does offer is that we do have counseling, right? So we recognize in terms of that healing, it is super important to have individual counseling, and that is something that we try to make sure is available for our patients.
Would either of you have any advice for people supporting survivors? Friends, family members?
The biggest thing, and we do sometimes have parents that come along with their kids, or maybe it's a family friend or a friend. I would say the biggest thing that I can say to anyone who is supporting a survivor is to provide very active listening, not asking why questions, right? So when we ask why questions, sometimes we're alluding to the victim blaming piece. So why did you go out at this time, or why were you wearing these type of clothes, or why were you talking to this person, you know? So understanding that it can happen to anybody, and that also we provide that active listening and just no judgment. That is the biggest thing that I can say, because we are validating them in some way, right? By providing that very safe place to kind of disclose.
You know, and I think sometimes with the patient's permission, you might have to talk to the husband or talk to the family to help them understand, because, you know, they might have their own questions about how did this happen to you and what were you doing that made this happen. So we want to make them into true supporters, as you're saying, not people who are making them feel worse.
If a lawyer contacts you, how best can you help that lawyer in providing an expert report?
Well, I think, again, first of all, they have to understand what they want to get. If they want me to just write something that says, oh yeah, you know, this completely ruined a person's life, and not have a more of a context, that I'm not the right person to speak to. But also, I need to look at documents. That's you talked about the importance of documents, and not just documenting when somebody told somebody, but everything that I can get that helps me say, who was this person before this happened, and what's happened since that time, and all aspects of their life, how it's affected them. So that's really important.
Great. Can you describe for us what you do when you carry out an assessment of a survivor of childhood sexual assault?
You know, I mean, I think the same issues that I presented are there. It's obviously trickier with children because you don't necessarily have many years history, kind of thing. But what you want to do is get whatever you can about the family dynamics, about the family history of mental illness or substance abuse, anything that would make the child vulnerable. And I think just in dealing, because it's, I don't see children, they're adults who've been abused. So they may still live with the idea that they should have done something differently. They were at fault. And to, you sort of get more support and opening up for them if you really talk about the fact that children don't know the difference. Mm-hmm. It's never your fault as a child. I think it's never your fault to be abused, but specifically as a child who may have felt, well, I did it and I went along with it and I got presents for it. Yeah, so you're a kid, and that, felt like a nice thing, because sometimes, maybe you have terrible parents and somebody's being nice to you and giving you presents. So to help them understand that that is not a reason that they should blame themselves for what happened.
Of course. I think that's all the questions I have for you today. Thank you both.
Are there questions from the audience? You've got some really amazing experts here. Yeah. Anything online?
Who's going to start?
I do have a question, actually. The question is, how have things changed in terms of survivor supports and societal supports in general with regards to survivors, things like that?
It's a good question. I mean, going back historically, I'll just tell you some of my personal experiences. So I was on, 1,000 years ago, the Task Force on Public Violence Against Women and Children. And that was set up by the government because there had been a number of assaults that summer. So one of the things we did that certainly changed things a lot is we were one of the people who suggested your program, and also set up special units with the police. It was also interesting for me to see that, I years ago again taught at the police college about abuse, and you'd have people reading the newspaper or snickering or whatever. It was really quite disgusting. And then a few years back, I was asked to speak at another police thing, and by now they have units that specialize in, exotic dancers or prostitutes or things. So they understand that just because you don't have a perfect way of life, you can still be assaulted. So I think there have been those kind of changes. I'm on the police has a sexual assault advisory council, and they have an ombudsperson who speaks to these victims to try to help them come forward. We made up a booklet to sort of explain the whole process. So I think there have been changes. I think you have to still go up against society that tends to think, well, if you didn't go to that bar that night, it wouldn't have happened to you. So we're still working on that. Absolutely. But there have been changes.
There's a question right up front here.
So TikTok has become a popular app, and many are going to it to feel validated. Something that's become popularized is this concept of the trauma Olympics, where people are talking about their trauma, and it's almost become a competition because everyone's becoming triggered. So I guess the question is, if a survivor is sharing with someone and they're opening up, and then the person receiving that information is then becoming triggered, what do you suggest for that kind of situation, especially if it's a family member? Because then the survivor then has to, support that person that's now received the information. That can happen with a professional too, right? Like a service provider. What's your suggestion when everyone's getting triggered and starting to talk about their trauma?
Well, group support can be helpful, but groups work well when they have a good facilitator. It's the same as men who are abusive and they have groups for abusive men. But if they don't have a good facilitator, it ends up guys saying, yeah, I understand why you hit that bitch, she was giving you a hard time. So, groups can be helpful or destructive. And I think if people are going on public media and doing that, they have to think about what are the consequences of that. You know, so to suddenly go on something where your family might discover that this has happened to you without knowing about it, I mean, that's a bad decision. I don't know how you get through to people, quite frankly, and say, think this through. I mean, it's good to come forward, it's good to declare that, you know, because part of coming forward is saying it wasn't my fault, you know, and that's important. But you have to realize there are other backlashes that can come along with that, and be prepared to deal with those backlashes. And maybe they have to, as I said, warn family in advance, or help them to understand, or have a good therapist they're already seeing to help them.
There's just a question right at the back.
I'm just asking if there are gaps in the way we treat and deal with survivors, and if there is areas that you still believe can be improved.
I mean, in terms of gaps, there are not enough services that are available. There are not enough affordable services that are available, and that's a problem. So that's, you know, that's a huge gap. And, you know, it really makes it hard for people to come forward if they don't feel they have some therapeutic support. So if you can't access therapeutic support and get feeling more comfortable, which then allows you to feel, okay, I have a right to complain about this. I don't have to keep this as my dirty secret. I think that would be very helpful.
Any other?
That the gaps in services is huge, and we've actually seen that with like the pandemic, right? More people are sicker when it comes to like their mental health, and there's just a lot of we see that our patients tell us that there's not enough mental health supports out there that are affordable. So I would hate to refer someone to private therapy, right? Because that's the fastest way to get therapy, but then it's very, very expensive. So we do try to see what kind of community resources are available, if there's any group programs, but a lot of these programs have wait lists. Even our program, like the counseling portion, has a wait list. So these are some of the challenges that we face.
We have a question from our Zoom audience, and it is, have the challenges for men coming forward are better now, and please explain the differences between women versus men in the process.
Well, I think in a lot of ways it's more challenging for men because, you know, men are supposed to be strong and you know, they can handle anything. And often with men, it's I think of two kinds of situations. So it's either another man who's assaulted them, and then they're dealing with all sorts of fears about homosexuality, and you know, they may wonder if they were secretly gay and giving off signals they did not realize and struggling with that, or they may assume that the therapist is going to think they're gay and they don't want that. You know, even if they are gay, they may not you know, find it difficult to think that a therapist will deal with them in a helpful kind of way. So I think a lot of that has to do, I think the issues are the same. I certainly have done reports on a lot of men. It's not just women that I see. And the repercussions can be the same. But I think the hesitancy in coming forward may be harder.
On that note, do you think that men exhibit somewhat different consequences? I find that some of our clients, the male clients, tend to be more aggressive, tend to have more assault issues, things of that nature, like physical assault and bar assault, things of that nature, whereas the women are less prone to having that kind of consequence, but sometimes more prone to getting into further bad, horrific, abusive relationships, things like that.
Well, you know, certainly we, you know, can see that just as if you grow up in an abusive household, boys tend to become more abusive themselves, and girls tend to get into abusive relationships because you kind of assume that's just the way relationships work. But in general, I mean, men have been socialized from the beginning that it's okay to be aggressive, it's okay to be angry, and women are told no, that's not a polite thing to do, and so women should not express angry feelings. So I think it is more likely that you'll see more anger and, you know, maybe difficulties with the police or assaults or things like that in male victims. Women would tend to turn it more into depression and maybe, you know, suicidal behavior, self-harm behavior.
There's a question from the middle there.
So obviously, you know, the pandemic's really shifted a lot of the ways that we work. You know, even in our legal profession, we've become a lot more digital, a lot more virtual. And I'm assuming your profession's also had to make that shift into a more digital, virtual space. So I was wondering if you had any, if you noticed any, either whether it was benefits or hindrances for victims or survivors to have access to your services. What have the pros and cons been of this shift?
Certainly we're doing a lot of virtual stuff now. We're fortunate in psychiatry. I don't have to, in fact, I shouldn't lay hands on my patients, so I don't have to physically examine them, and so it can work quite well depending on the situation. It's always better to see somebody in person. It's you know, you can establish a easier relationship kind of thing. But I think there are certainly benefits of the Zoom. You know, when people are on Zoom, if they're talking about something that's very upsetting, they may want to go into another room for a few minutes and you know, settle down and come back. And you know, it's easier to do than walking out of your office and coming back. And it just gives them a little bit of an emotional distance where they feel, you know, they can talk, and it's not quite telling me those things, but you know, it's almost confessing to the air, if you like. So I think you know, there are some situations in which it does not work. If somebody finds it really difficult and artificial, and you know, that's a trouble for them. But there are other situations, and even seeing people who live far away, you know, where they don't have to make a trek to Toronto to see me, that they can be wherever and see me. So it, you know, like everything else, good and bad things to it.
With our program, we had never explored virtual care before the pandemic, and it was always in person. So if anybody wanted to access our service, the only way our nurses would be able to do an assessment was in person. But one of the things that did come out during this pandemic was the virtual care. So we were able to provide phone call assessments around intimate partner violence. So we could do safety planning over the phone with patients if they weren't able to come in. And that has continued, and we will continue that.
There's a question just back there.
If survivors resist seeking out treatment for fear of reliving or increasing their trauma or worsening their mental health, how would you respond to that and perhaps encourage them not seeking the treatment?
Encourage them to not seek treatment, or to seek treatment?
To seek, yes.
Yeah. Well, I mean, the trouble is, first of all, are they going to show up? That's an issue. You know, if it comes out, for example, somebody comes for, you know, they come because they have depression or anxiety or problems in relationships, and then it turns out that they have had abuse in the past. You don't immediately start just solely focusing on the abuse. You have to give them time, you know, to say this might be a significant kind of factor in your difficulty in relationships. And then you may go away from it for a bit and then come back. So you try to ease people into it. They obviously have to trust you, and that may take a while because there are often huge issues in trust after they've been abused. So I think it's a matter of giving them time and space to feel that they can open up, and you're not going to be judgmental, or you're not going to kick them out, or think that they're an awful person because of what has happened.
Well, thanks for being here. First of all, it's really great to have access to ask questions like this. You talked a bit about barriers to treatment, funding or accessibility, even awareness of what resources might be out there. But just in your own experiences, have you been able to sort of identify groups or underserviced populations that you think are, essentially crying out for help, that had we the resources and the availability, that would be a place you'd want to start trying to reach out to people?
Yeah, that's a very, it's a great question because it makes you reflect on your practice, right? And sometimes I find that there are organizational structures which could limit you from providing the care that you really want to do, right? So for example, I'm trying to think of someone, a patient who is homeless and is at a higher risk of experiencing sexual assault. We already know that places them at a high risk, right? So now they've come to our center and they're accessing service, and we're going to provide them with the services. But what happens after that? And so this is the piece that we really struggle with, and sometimes we are challenged. What services can we offer them beyond that? Can we put them in a safe place? Is there any safe place for them to go? I think calling central intake and getting them another shelter bed, again, we're putting them back out in a very unsafe situation. So I feel like the structures that are in place, sometimes it makes it very difficult to provide very wholesome care.
I think there are two issues that can come up. One, there are certain groups that I think it's harder for them to come forward. And if you come from a very traditional ethnic group that sort of values purity in their young women, those women find it very difficult to admit that anything has happened because they can be really seen as having no value anymore. And so how are they going to come forward and admit that this has happened? I think the other issue is, the therapist's sort of race and background. I mean, I'm a white woman, so there are some people who might think I could not understand where they're coming from or not understand their situation. So to have people of different ethnic backgrounds who do this kind of thing. I mean, I teach our psychiatry residents about abuse, domestic violence and sexual abuse. So hopefully more of them will go out and be able to do this kind of thing and present a more diverse group of therapists.
A question from the middle?
I have a question about the interplay of the experiencing this kind of abuse as a child and whether or not you see a higher incidences of people engaging in like domestic situations of domestic violence or abuse later on in life. And I have a follow-up question if the answer is yes, which I suspect. Again,
they're slightly different issues with different kinds of abuse. So as I said, if your abuse is that you've been in a domestic violence situation with your parents when growing up, I think we very commonly find women get into other abusive relationships, and it's hard for them to have expectations that they can be treated better. For people who've been sexually abused, it's interesting. So some of them get into, I don't want any sex with anybody, I don't want partners. And others get into, very loose sexuality because they have no value and what does it matter? Why should they protect themselves or preserve themselves for anybody? So I think certainly there can be repeats.
So for you. Do you find the same thing? Do you find that you effectively, as Dr. Robinson just said, have kind of, so to speak, repeat customers?
Yep, yeah, repeat patients, but then also once we start talking to them about the emotional support piece, it sometimes will come up in, conversation that they experience childhood abuse. And so you do see that where they may be engaging in certain behaviors that is putting them at risk, of being assaulted again.
Mm-hmm. Do you find that there's anything you as healthcare providers can do to help them effectively break that cycle? Like, is there something that you found? Like, I know there's no silver bullet. Every person is individual, but is there like a specific way that you'll approach maybe a conversation that puts them on the path to recognizing they don't need to put themselves in those situations?
Well, I think there are a number of things that come into play. First of all, patience with people, because you don't just say, well, you don't have to do this anymore. You're doing this because of that, and so stop it. People get entrenched in their way of looking at the world. I find it very helpful to explain the issues to people. When people are sexually assaulted, or when people are in other abusive situations, they often feel they're the only person in the world, because they don't talk about it and nobody else talks about it because everybody's embarrassed and ashamed. So they're the only person who's been assaulted and had these consequences. So explaining how people react when they've been traumatized helps them to sort of say, okay, well, maybe I'm not weird or abnormal, and if I understand why I'm behaving this way, then it can help me to say maybe there's a different way that I can behave. So I do a sort of education to them as well.
I completely agree. I think if someone's coming forward and disclosing that information, again, we don't want to blame, right? Or be like, okay, we found our answer as to why you're doing this. That's the worst thing that we could say. But giving them that space and then to disclose, but then also now exploring it even further. So I'm a strong believer in therapy, and I think that would be one of the things to start exploring, right? Or like processing trauma and working through just unlearning, taking all the layers off. So I think that would be very important.
And sorry, I'm just very curious. So I have some clients, and they become, as we go along the process, they become more and more, and I don't want to say afraid, but it's more like overwhelmed at the thought of having to confront some of these really difficult things again. So I find that sometimes they withdraw, or they hold back, or they start really entrenching in maybe avoidance behaviors or deflection or lashing out. So as that process goes on, do you find that it's helpful to encourage them to kind of sit with those feelings and go through it? Like, what do you do to help them if they start approaching that point where it's clear that they're overwhelmed by their emotions?
Well, I think that's where patience comes in. If for example, you see somebody who's a victim of domestic violence, and what can happen is, it's very clear, and you say you shouldn't have to deal with this, and nobody deserves to be hit, and whatever, and then, 2 months, 3 months later, you're still saying the same things. And it's very easy as a therapist to say, well, I give up, this person's never going to make movement. But to realize how difficult it is to move out of entrenched behaviors, and how scary it is. You think, they just think they'll be free, but they don't know another way of dealing with life. So I think you need patience, and sometimes they say, I can't deal with this for a while, and you say, well, back off, and when you want to come back and talk more, let me know. So I think it's important to give them that time, and also say, this is very understandable. This is what happens to people. Of course it's scary to go back and relive things, but we'll give you time to think it over and feel when you're ready to come back.
Time, I think, is the biggest thing, yeah. And then just being there to listen when they do come forward or they do want support.
There's a question up here.
I just wanted to make a comment in response to your question. As someone with lived experience, I just want to say that I understand the question, because in a way, like, when you're working with a lawyer, they need to meet certain deadlines. It's work. So So you understand that you're working with someone who has this lived experience, so you want to be sensitive. But what I can say is something that's helpful for me as the person with lived experience is understanding the impact of delaying things, the consequences. So if someone were to say to me, okay, I understand you're not ready yet, you need to engage in this avoidance behavior and deflect, but that's okay, I just want you to know that these are the consequences of doing that. So if someone were to say that would be helpful. I've actually have had a lawyer said to me very recently that they thought I just let it go. I have a different situation at hand, but that was really hard to hear because I don't want to hear that someone's given up on me. So patience, but also not giving up on the person.
Sure. And it probably has to do with, as a lawyer, you have to appreciate your client. So you can't say, okay, you've come up and we're going to have a hearing, in 4 months and let's get going, because that kind of deadline may not work for your client.
Sure, I can just give a little bit of a lawyer's perspective. We at my firm, we always try to accommodate the client as much as we can. Absolutely. If you're having a bad day and we have a meeting set up, we'll move it to another day. We try to do that. We try to understand the best that we can. No judgment ever. We would never say just get over it. I think that's horrendous that lawyer did to you, and I'm sorry for my profession for that. But the reality, of course, is that sometimes we do have deadlines that we wish we could move, but we can't. What we try to do there is sort of give enough space, enough time, so that we know it's coming up, and we try our best to make it as easy as possible for clients. And yes, unfortunately, there are things that can't be helped in the legal profession, but we do try to explain why we need it, why we have to have it, why it can't be moved, and if it is moved, this is what's going to happen. So we do try to do that as best we can. Was there another question? Yes.
Yeah, so the hesitancy that men have when it comes to seeking care for this, it seems a lot of that has to do with not wanting to adopt or be saddled with a victim identity. And I'm just wondering if there's a conversation about how to communicate that there's another side to it, because I just know, I know there's like a little bit of research, but I just know in my own experience trying to communicate the value of any kind of mental health services to another man is often like, I don't want to wallow in this the rest of my life. I'm not going into a room to share my story so I can have a pity party. And I just wonder about if there's a conversation about how to get around those kinds of barriers.
Well, I think my response would be, I don't want you to wallow in it. That's why I think you need to have some help so that you're not having this influencing your life anymore. You can put it behind you and you can move on. Because here are the ways that it's affecting you and making you unhappy. And let's see if we can get you into a better space. So it's not just to churn things up and you go over and over and over again. We don't have to keep talking about the actual abuse over and over again and reminding things. We have to talk about what it's done to you and how you can work on changing those things.
Any other questions?
I think my question kind of connects to yours. It's more general, and it could apply to different kinds of trauma, but what do you suggest people do that are trying to support someone that clearly has experienced traumatic events based on what they describe, but the survivor themselves doesn't want to accept that they have experienced trauma, and as a result, they just never get better because they don't get help. So what do you do with someone like that? I guess back to my statement before, though, that we don't often see those people.
They don't come for help.
Well, how do you get them to get there?
Well, but that's, I don't think, well, let me change that a little bit. I think the other way we can do it is maybe having conferences like this, or maybe speaking and presenting. So people get the idea that there is help out there, that you're not a bad person because you've been abused, that things can change for you. So I think that's maybe one way that you try to give people the idea that, you know, it wouldn't be so terrible to come forward, and maybe it would be of benefit.
That's helpful, thank you.
And I think the one thing to acknowledge is that everyone has their own process, right? So we could try to push someone to come, and we see this a lot where like someone will call us, they won't tell us their name, right? And they'll be like, okay, I'm going to come in an hour or two, and then we don't see them. So it is very, very hard for that person to probably just step out and come forward, right? So I think as a support person, just understanding that that person has their process, and once they're ready to come, they definitely will.
Well, thank you very much. That was a very informative panel. Thank you very much. Thank you, everybody, for coming back, and to our Zoom audience, thank you for coming back from your break as well. We have a fantastic keynote speaker today. Very excited to hear her talk. I haven't known her for very long, but what I can tell you is that she is absolutely engaging and a wealth of knowledge. Colleen Heel Cardinal is Nehiwa Isquiu. Did I get that right? Almost. Which translates into Plains Cree from Saddle Creek Cree Nation in Alberta. She was adopted and raised in Sault Ste. Marie, and she's currently a community organizer, social justice advocate, student, author, and cook. Her works include organizing 4 national 60s Scoop gatherings in Ontario, which is an amazing feat, raising the issues of the 60s Scoop even to an international level, and as well as the displacement and loss of identity of survivors have experienced. Colleen is going to be a fantastic keynote, and I urge all of you to welcome her.
Tupiko Piesu, Indishnakas, Sadalek and Dojiba, Miskwatsi, Megazi, and Dojiba, and Indishnakas, Dodam. Sorry, messed it all up. So I'm Cree, but I was raised in Ojibwe territory. So my name that I gave you in my territory was, I said in Cree, but everything else was in Ojibwe. So this is the conundrum of being displaced from your territory and raised in another territory. And I'm also on as a guest here today on some other folks' territory. So I'd like to acknowledge the Mississaugas of New Credit, the Haudenosaunee. So I don't come to actually I haven't been to Toronto since before the pandemic. So it's kind of cool to come back and see some more condos. But I just wanted to acknowledge the traditional territories of the Mississaugas of New Credit, the Anishinaabeg, Chippewa, Haudenosaunee, and Wendat peoples who have thrived on these lands since time immemorial. Thank you for the introduction. I want to give a shout out to Simona Jellinek and I don't know the other person's name, Ellis and Gluckstein, and also Shelley for making my arrangements and responding to my emails. I'm so honored to be here and to share with you some of my truths of my journey of being a survivor and doing the work that I do now. And you know, I wrote a book. I wrote my memoirs, published them back in 2018, and I got to a point in my story where I had written about all the bad and I had a hard time writing about all the good. And somebody had said, how did you go from that person to this person? And I'm like, I don't know. So I had to really like get down to the crux of it and talk about my transformation and all the people that helped me, because I didn't do it alone. I had help. I had to do a lot of unlearning and relearning. So I'm here to share that with you today and talk about a system that was meant to erase me. Sometimes I'll start my presentations just saying, I'm not supposed to be here. Because I truly believe I wasn't meant to find out what happened to me. I wasn't meant to relearn my culture. I wasn't meant to heal. I'm not supposed to be a success story. I'm supposed to be, the stereotype, that drunken Indian on welfare, down and out, no good for nothing. And, when you're raised in an environment that teaches you that every day, you start believing it. So I'm very proud of who I am today and who I've become. So from survivor to thriver. Sometimes survivors don't like to be called survivors. It kind of, it really depends on where you're at in your journey. And for me, I don't mind being called a survivor. I survived a heck of a lot of stuff. But I'm also thriving very well, thanks to medication. I'll get to that later. It took me a long time to find out what happened to me. And it's because I had nobody to give me context. So I'll share a little bit of historical stuff with you, and then I'll get to the healing part of how I came to be doing the work I am. So I found out later, 2015, that I am a daughter of a residential school survivor. Residential school survivors is something that's at a national conversation. It's given a lot of attention, but I actually didn't know that my mother went to residential school till 2015. So most of my life, I didn't know. You know why? Because nobody talks about it. Survivors don't talk about what happened to them in those schools. At that time, my mother, my biological mother, did not talk about what happened to her. And it was only through research, my own research, that I found archives of her at Blue Quills Residential School. And it helped me gain understanding into the course of what happened to my sisters and I. I have two family members, two women in my family who were murdered, my older sister and my sister-in-law. And that's some trauma that I had to recover from as well. And of course, I've shared with you, I'm a 60 Scoop survivor. I was adopted into a non-Indigenous household, a very violent household. I don't call it a home, it was a household. It was a place where I lived with a roof over my head. There was nothing homey about it. My two older sisters were also adopted along with me. One of them has passed since, and the other one is still very much having a hard time in her life. I'm a survivor of childhood sexual abuse, specifically incest, and childhood trauma of physical abuse and racism. I grew up in a very racist household, which is strange to hear because I get asked a lot, why would people adopt you and mistreat you? We'll get to that. Children's Aid Society did not protect us. As children, they were, there was times where my sisters and I had reached out to them for help, and they brought us right back home. Very comparable to the RCMP rounding up the children for residential school and bringing them back to their abusers. Later in my life, I picked violent, abusive partners. I just went out and said, "Are you violent?" No, I didn't do that. Unconsciously, I did this, not knowing that, I was looking for somebody like my dad. My husband, who's now deceased, he just passed in 2018. I had been separated from him since 1996, I think. He was very violent, very, very violent. It took a lot for me to escape him. My last escape from him was after he assaulted me. He had raped me. And I remember asking the police officer if he could be charged, what it was. I knew something bad had happened to me, that it wasn't the same as having sex with your husband. And they told me, yes, that's rape. And I'm like, oh my God. So that is possible. I didn't know at that time that husbands could be charged for that. I thought it was just part of a normal relationship. That's how things were. I self-medicated with alcohol. I didn't really look at alcohol as a problem at the time because it was part of coping. I think I started stealing beer from my father, my adoptive father, as soon as I could get away with it. He would always have a case of beer, and I would just take a bottle of beer and go drink it in the bush. I was drinking wine. I used to play piano. I used to play piano at school. they would put the piano in a storage room, and along with the piano, they would put the church stuff in there, so the wine and the little crispy wafers. And they didn't lock it up, so I would just help myself to the wine, and I would get drunk drinking while I practiced piano. So I didn't think it was a problem back then, but I realized at the time when I quit drinking that I had been drinking pretty much my whole life. Until I was 29, I believe, is when I quit for good, and I haven't had alcohol since. You know, it was a way of coping with life, but it ruined my life to a point where I almost lost my kids. So I've been sober that long. I don't have a problem with alcohol now. I choose not to drink because I am very much involved in my culture. I do carry tobacco for ceremonial reasons, so we believe our alcohol alters our mind and our spirit, that we're not the same person as we were without alcohol. So I don't drink alcohol. I also wanted my children to grow up not being exposed to alcohol and seeing me drunk. When you don't know what normal is, violence was my normal. I thought that everybody got beat up. I thought all children got, abused. I thought these were normal things. And it wasn't until I was, when I quit drinking and I got out of that lifestyle, domestic violence for me was the norm. And it was so strange to live without violence. I actually kind of missed it a little bit. I missed the drama of it, and that's all that toxic behavior that you have to unlearn. When I was writing my book, I remember thinking, it's been 10 years since I've been hit. And I'm like, oh my God, I used to get hit at some point in my life. I was listening to some of the panels talk about how it impacts your life to be a sexual abuse survivor. And yes, I'll go through some of the things and how it's changed my relationships. It's impacted how I have relationships with men and women. I had to unlearn a lot of unhealthy thoughts and beliefs about myself and about women. All of that had an impact on my life as a survivor. It took my whole life to learn what happened and why it happened. Because not only are you learning about, oh my God, all this stuff happened in Canada and it happened to Indigenous people. And I'm not just a survivor of sexual abuse, I'm a survivor of a system that was meant to assimilate me and erase me. So I'm going to get into that with you. I'm going to correct you a little bit. I know people are really trying to say Cree. I had to learn it myself too. So my identity as a Nehia Esquay, which is a Plains Cree woman, Esquay means woman, from Treaty 6 territory, was almost erased. I didn't know who I was. All I knew was I was adopted, and that the people I identified with the most were non-Indigenous people. I thrive very well in those environments because that's what I'm familiar with. And we have a thing where adoptees, we can code switch, so we can go from one environment to another very easily, and it actually is quite good for our benefit. It's just the truth. This is important to me. I talk about the treaties because it is the making of Canada, and for folks to understand what it means to erase Indigenous children's identity and to cause trauma so much that they hate themselves, that they want to self-medicate and harm themselves, you are literally committing genocide. The point of my conversation today is not only to talk about survivors of sexual abuse, but also the attempted erasure of Indigenous people, so there are no treaty people left to hold the government accountable to the treaties that they signed to share the resources in Canada. I think a lot of folks don't understand the treaties. How many people here understand the treaties? Okay, how many people here know what the treaties mean? Okay, this is great. I could start from zero. So I love talking to first year human rights and criminology students. I do a lot of lectures for them, and I'll show a map of Canada, not this map, but a map of the provinces and territories and all the capital cities. And I'll ask them, how many of you know your provinces, territories off by heart? And they'll say, how many of you know your capitals? How many of you know which treaty territory you live on? None of them know. How many have ever seen a map like this? None of them know. Treaty making, treaty signing, was an agreement between the state and Indigenous people to share the land. And in exchange, money is put aside for Indigenous people forever, until everything runs out. So everything, every stump, every diamond, every drop of oil, everything that comes out of the land and off the land, forever, money is set aside and managed by Indian Affairs for Indigenous people. In exchange, the wealth that the state derives from these resources funds Canada, funds your infrastructure, funds your military, everything you know about Canada exists because of the treaties. I'm Treaty 6, so I'm from the middle part there, between Saskatchewan and Alberta. Our treaties were signed way back in the day in very old English. If you ever looked at the original treaties, you would see, a lot of our leaders signed with an X, because they didn't write English, they didn't speak English. So did they really know what they were signing? I don't know. So when you look at the treaties, our Treaty 6 was an oil-rich treaty. Lots of money is generated through that treaty. And in every treaty territory, there's different clauses. The medicine chest, the cows and plows, they were given equipment once a year. We're paid $5 or $6 a year to collect that. And that's basically the state saying, here's your money for your treaty. We're honoring the treaties by giving this $5. Well, $5 was a lot back in 1876, right? Or 18 whatever. This one, 1876. $5 was a lot. Could you imagine what that is now? What would $5 be at today's, inflation or interest rate? The cool thing is, the Robinson-Huron Treaty, which exists from, it's in Ontario here, on the north shore of Lake Superior, all those bands along there, they took the government to court and they said, we want what the treaty's worth now. And they took them back to court and they won. Now the province is fighting them. Canada is in debt to us. They have chronically underfunded our communities. We should not be living in poverty, without housing, without clean water, when the rest of the country is flourishing. So these treaties, if they didn't tell you about this in school, it was deliberate, so that you wouldn't know, so that you would not have to challenge the Canadian government for why Indigenous people are in the state they are today. And if you have a whole bunch of children who grew up not knowing where they come from and not knowing about the treaties, they can't bring the government to task to it either. So then the government has free reign of it. So there's a little bit of history. I don't know if you knew that or not, but now you know. The Indian Act. Oh, the Indian Act. See this? Burn, sage, sweetgrass, and the Indian Act. I was going to dress up. I was going to dress up to the nines today. And I'm like, I got my dress pants and my dress shirt. And then when I heard that not everybody's dressing up, I'm like, okay, I'm going to wear my street clothes. So the Indian Act. Everybody here knows what the Indian Act is and how much it impacts our life. All right, so the Indian Act was a very paternalist statute passed in Parliament to talk about how Canadian government deals with First Nation people in Canada. It was passed in 1876, a long time ago. It literally gave the government power over Indigenous people. It treated us like wards, like children, and it still does. The purpose was to encourage assimilation. So a lot of people back in the day, back in the 40s, 50s, they sold their status rights for money so that they could leave the reservation, or that they could work or go into the military or go to college. They had to do that to get off the reservation. Back in the day, you weren't allowed to leave the reservation without a pass. You had to ask the Indian agent to leave. I don't want to get too much into that because that's intense. So basically, the Indian Act still exists today. Our money's still managed by Indian Affairs. So the government literally employs non-Indigenous people to manage our money and give it out to our First Nations, and they decide how much we get. It's not a treaty, it's an act, so it's very different. Duncan Campbell Scott at that time was the Department of Indian Affairs. Every single person I know who's Indigenous knows who Duncan Campbell Scott is, because he was an oppressor and a colonizer, and he believed in the assimilation so that we were absorbed into the greater population and that we weren't distinct. We wouldn't be able to hold the government accountable to anything they've done. The 60s scoop. How many here know what the 60s scoop is? All right, great. That's good because a lot of people don't know about it. So the 60s scoop is just basically kind of like a slang term for an era between 1950 and 1980s where they took over 22,000 children like myself and who were overloaded in the foster care at that time. And to give you context, the reason why so many children were in foster care, because their parents were residential school survivors. So they had no parenting skills, they were institutionalized, they were self-medicating with alcohol, they weren't employable because they had no education. It's just, anyways, kids were taken from these parents and the foster care system was overwhelmed. So they started aggressively adopting children out through solicitations. Actually, I'm going to share that with you. Through newspaper ads, through television, adoption programs called Adopt the Indian Métis, like puppies. We were trafficked through the child welfare system. My sisters and I were placed in a catalog of children that were up for adoption. And I know this because I asked my adoptive mother why she adopted us, and she said, oh, we picked you out of a catalog of Native children up for adoption. These catalogs exist. And not only is there Indigenous children are hard to adopt children, there are non-Indigenous children who at that time were called Mongoloid, which was intellectually delayed children. We weren't explained. Now, Dr. Raven Sinclair explains in some of her research that we were talked about as if the people who adopt us would add to our life, but non-Indigenous children were talked about how they would add to your life, which is a different language, like as if we were, destitute and needing somebody to take care of us. Almost all of us that were trafficked from BC, Alberta, Saskatchewan, and Manitoba, a lot of us were put onto farms and made to work and treated like second-class citizens. I don't think the homes were screened very well or screened at all, because a lot of us were placed with non-Indigenous households who treated us like slaves. I don't want to use slaves in a derogatory context, but we did all the work for the whole household, while their own biological children didn't. And we were punished, and they're physically and sexually. Their own children didn't have to do that. This is a common story for a lot of adoptees. On the outside, you look at our family. We were given some opportunities. We were raised in a middle class home. My mother was a supply teacher, and my father was a steel worker. They made decent money, I guess. Went on a lot of family trips. I was in sports. We played piano. They dressed us up like Indians, even though I didn't even know I was Indian. This photo is like, for me, it's very telling. Anyways, they had their own biological son, and behind closed doors, though, we were not treated well. There was no cuddles, there was no hugs, there was no kisses, there was no goodnight stories, there was no tenderness. We grew up without that. I don't even know what that looks like. So this is an effect that's had on my life and my children. Affection was not given or shown, so I grew up not knowing what that was or how to give it. I like to call it the othering. So basically, it's when you have a group of people that look down at you like you're not even human. So they can do things to you because they don't view you as a human being. You're not even considered as good as the dog, the family dog. And when people ask me, how could people mistreat you? And I'm like, because the mentality at that time, the 60s, 70s, 50s, whatever, and the government's mentality was that Indigenous people were not humans. They were savages, and they needed a certain treatment for them to be considered human. To have it beaten out of us, to have it the way they talk to us, and it's still very much a part of my life. I actually forget I'm Indigenous, thanks to all the brainwashing, until I experience racism in a store or something. I forget, and I'm like, oh shit, it's because I'm brown. You know, it's part of my life. So can you imagine how many children went through residential school, had their children taken away? Over 22,500 of us have been taken from our households and adopted into adopted homes within Canada, United States, and overseas. And through Dr. Raven Sinclair's research, almost more than half, maybe 75%, have experienced childhood trauma, sexual abuse, racism, and are either living with it unresolved or trying to find help. A lot of us are my age, 40s, 50s, 60s, and are just starting to talk about it and heal from it. Identity is a huge issue. I still deal with identity issues. As a First Nation person, I suffer from imposter syndrome. And does anybody know what that is? I even when I go to a community gathering or a cultural gathering, I still feel like I don't feel Indigenous enough. Even though I very much look Indigenous, I still feel like I don't belong. And that's all in my head. So it's a barrier for us to get healing from our elders, from our community, to go back to our communities, to access urban centers, because we feel like everybody will know that we were raised in white homes, or that what we called names like apple, like red on the outside, which is so derogatory. But this is real stuff. So when I talk about identity, maybe I missed this slide here. Hold on. This one, identity. So this is my birth certificate. And I never really looked at my birth certificate until, I don't know, maybe 5, 6, 7 years ago. And I realized, oh my God, my adopted parents' names are on there, of course, but my adopted father comes from England. And my adopted mother, she was born in Ontario, but her mother comes from England too. So just looking at this face value, it looks like I come from England, right? You would say that if you didn't know me. Which completely erases my connection to my land, to my kin, and my nation. And that's when it hit me. Oh my God, they've completely erased my identity. And if I don't have a connection to my land and to my culture, and I don't have identity, I'm absorbed into the mainstream culture. I'm not invested in my traditional lands, and I could tell you for truth, I had no interest in going back to my community or going out into the land and doing ceremony. I'm like, why would I do that? That sounds so weird. I didn't know what that meant, or valuing relationships with each other, or with this may sound, when I go back to the other side, it'll make sense. Not valuing our relationships with the land, the animals, and all living things. A lot of us don't know we're entitled to status or oil trust funds. So when I turned 18, I had a $40,000 trust fund waiting for me that I found out on my own. Nobody told me. And that I might have land where I come from. I found out I don't. But our membership, like, we just grow up in silos, and our adopted parents aren't going to tell us where we're from. They don't know any of this either. I mean, they know as much as you do about it. So can you imagine all these adoptees trying to get help and figure out who they are, but also recover from physical, sexual abuse that they've lived with and hid sometimes for most of their lives? This is my birth family. Now, I did meet my birth family, but when I met them, my birth family were very deep in the throes of addiction. They were self-medicating. I'd never seen that before in my life. It was a culture shock for me to go back to Edmonton and see most of my family living on the street, and in different states of addiction. Nobody really talked about us because I figure because it hurt too much to talk about the kids that were taken away and never seen again. And I can't imagine how my mother coped with that, having all 3 of her daughters taken away and not knowing where they are. The shame and the guilt and the grief that she lived with, it helped heal something for me, because then I didn't blame her anymore. I was really angry at her for a long time. I found pictures of her at the residential school archives, and I got to know a little bit about their lives. Most of them, almost all of them, except for 1 or 2 aunties are passed away. The picture of my parents, the one you see in the black and white in the corner, in my adoption records it said my parents were alcoholics. That's how they described them. They didn't say, they had brown skin. So they're brown skin, they're alcoholics, and there was some neglect. That's how I pictured my parents, right? And the view I had of my parents was they were drunks and alcoholics. But I see this picture, and this was given to me by somebody as a gift. They said, I have a picture of your parents. And seeing my parents together healed me, knowing that at one point they loved each other. At one point they were happy. In this picture they look happy. And it helped me heal, because I'm like, oh my God, this thing I have about my parents, By the time I met them, they were divorced, and they talked crap about each other and blamed each other for us being taken away. But seeing this picture, I'm like, okay, at one time they married each other, they loved each other. Yes, they had their issues, but and then seeing a picture of my kokum, she loved her grandchildren, and they wouldn't let her raise us. So these pictures have been like little gifts that have come to me that help me heal. Navigating healing for myself. When you don't really know what you need, or when you don't know what you don't know, how do you ask for help? There's nobody there to just say, oh, you go over here, this is where you can get help. Identity, language, and land. This is so important, and this has to do with identity, not just on the paper, but identity as Indigenous people, and how we're connected to the land. And that's where our language comes from. And it wasn't until I took Anishinaabe Mowin at university, I took 4 years so that I could work and communicate with the people in the territory that I grew up in, which is Bawating, which is Sault Ste. Marie. Bawating, it means the gathering place. The predominant language there is Anishinaabe Mowin. And when I'm learning that language, the language teaches you how to live with each other and how to acknowledge living and non-living things, so animate and inanimate. And whether they're living and have spirit, and whether they're not living and don't have spirit, will tell you how to take care of those things. And that's all included in our language. So you would acknowledge a person as a woman with a spirit. And depending on what that person is doing would tell you how to take care of that person or how to acknowledge that person. Same with men, same with two-spirit, same with a tree. A tree can be a tree living, or it can be wood that you're putting into a sweat. A mishomas, a rock, to us is grandfathers, and they take care of us, but they've been on the land forever. And how we talk and treat those things is in our language, it's in our songs. So when we lose that through assimilation, we're losing a part of our identity and how we connect and take care of each other. And the language is supposed to teach us, it's like our code of how to live, how to be amongst other people, how to interact with each other and take care of each other, doing no harm and respecting all living things. And we've lost that, but we're getting it back slowly. It takes a long time to learn language. English is bad enough. English is hard enough to learn. It keeps changing. And we're healing. So when you think about the number of years that we've been oppressed and hidden and had things put upon us, we're starting to catch up. Slowly. We're starting to heal, and we're starting to reclaim our spaces. You're seeing a resurgence of folks who are pushing back, and however the media spins it, because we're figuring out what happened. And whether non-Indigenous people are going to unlearn that with us, we're still going to do it. Anyways, so part of what I do is not only this work. I work with 60 Scoop survivors. I do a lot of unlearning and helping people unlearn, and educating caregivers, frontline workers, first year, second year students, and a lot of them have never heard of this at all because it's not part of their life. Unless you're actually going into a field that works with Indigenous people, you wouldn't have any need to learn this unless it's a special interest for you. So one of the things that helped me heal was people validating what happened to me and affirming that, yes, these things are real and these happened to you, and I believe you. And that made all the difference in how I move forward with my caregiver, with the law firm, with people in my community. I don't want to argue with people about my experience. I shouldn't have to. Or being gaslit. Did that really happen to you? Are you just making that up? Or did somebody say this? Yeah, so we don't want to be gaslit. So as caregivers, providers, and people working with Indigenous people, especially Indigenous people who have historical sexual, physical violence happen to them, what do you know about the impacts of colonialism on Indigenous people and their families and what they're going through? How does it affect you? Does it affect you? What services are you connected to? Are they safe? Are they reputable? You know, we have a lot of what they call pretendians coming out who are faking their way into organizations. We have elders who are harming people in organizations. We just had one in a local place in my community who was inappropriate, sexually inappropriate with people. So vetting the services that you're connecting to, finding out from people who the safe people are, making sure they're not judging folks based on their background, their experiences. It can keep people from getting help. Meeting us where we're at, adopting a harm reduction framework is so important. You know, because some people are still actively using, and they may not be ready for help, or maybe they just need help that day. But meeting us where we're at, and I don't mean on the corner of Bay Street. I mean, like, you know, if we're, you know, sex working, if we're actively sex working, if we're using, if we're like, you know, living in poverty, meet us where we're at, and we'll decide where we're gonna go. And keep meeting us where we're at. That can be hard. You know, some people want their clients to be sober and, you know, participating and stuff like that. But I know, and somebody had shared earlier, that healing is not linear. It can be 2 steps forward and 10 steps back sometimes. But we want people who will meet us each time when we're ready. Are you perpetuating harm or helping in your helping practice? Are you unlearning stereotypes? Do you know the stereotypes? You know, are you addressing that? Where did you learn it from? Because that's part of our culture. In school, I learned a lot of stereotypes. I had to unlearn a lot of stuff, even as an Indigenous person. And we do it to each other. Indigenous people do that to each other too, you know? So we're constantly having to challenge ourselves and our people around us. Historical abuses. So how are we supporting and helping people report historical abuses? And I'm finding, like, as I do this work, more and more 60 Scoop survivors are asking for support. How do I get a lawyer? How do I get help? Where do I get counseling? I'm going to share that with you too. Making sure that we provide culturally relevant emotional mental health supports. Whatever community you are, make sure that you know who you can send these folks to. I don't know what they are here in Toronto, but I know what they are in Ottawa. And I work as a crisis counselor for a national crisis line, the Hope for Wellness. I also we have all the contracts for the residential school support line, missing and murdered Indigenous women, and there's another one. Anyways, we have all 5 contracts. So all those calls come to our call center, and we have lists and lists and lists of culturally relevant supports. if somebody's two-spirit, or if somebody's trans, if somebody's like a youth, if they've experienced sexual abuse, or if they've had a missing and murdered Indigenous family member. Like, we have all those supports. So if you don't know, make sure you have a resource for folks. So one of the things that helped me when I went to get support, I live with complex PTSD. I lived with it undiagnosed, probably like since my trauma, since my childhood. And I didn't know that I was being triggered daily. And I was a rage monster. So what I needed from a therapist and a counselor was somebody to tell me what was happening for me and why I was doing the things I was doing. That helped me understand myself, so that it took all the shame out of it, out of like, when I act like this, I do this, and I don't understand why I act like that. So for instance, if somebody put down like a cup like that would trigger me. Sounds ridiculous, right? But I grew up in a household where anything like that meant violence. If a door was slammed, violence. Loud footsteps, violence. Men with alcohol on their breath, aggressive men with alcohol is a trigger for me. And what happens, my body goes into fight or flight. I get a huge rush of adrenaline and I'm ready to fight. And it comes across as being really aggressive, really angry, ready to fight in your face, like a rage monster, and ranting. And I didn't understand why I did that. And it was affecting my children. And they were teenagers at the time. They're like, "You're really scary when you're angry." And I'm like, whatever, don't piss me off. And I didn't understand why I act like that. And I thought, I must have got it from my adoptive father, because he acts like that too. And it wasn't until I went to therapy, I went to a doctor first, because I almost wanted to harm somebody. I pulled a knife on my daughter's girlfriend at the time, because she got in my face, like right up in my face. And I pulled a knife on her, and I chased her through my house. And thank God she closed the door, because I thought I would have hurt her. I couldn't stop myself. The adrenaline to fight was so intense. So I took myself to the doctor the next day. And you know what he said to me? I thought he was going to call the police on me, because I said, I'm really angry. I get really angry and I feel out of control. Like my blood boils, like I can't calm myself down. And then when I am calmed down, I'm exhausted, right? Imagine living like that for years and years of like these heightened states of like aggression, not understanding and thinking that you're a monster. And you know what he said to me, the doctor? He said, "You've been through enough in your life. My job isn't to make your life harder, but to help make it easier." And I cried my eyes out, because nobody in my life had ever said that to me. And he helped me get on disability. He helped me get referred to a psychologist to get diagnosed with complex PTSD, and a referral to a counselor who could work with me and help me understand why I was exhibiting the behavior and deal with the trauma that I experienced as a child. He changed my life, that person. And he was a non-Indigenous guy, and his wife was a 60s scoop survivor. And I write about him. Like, I wrote about him in my book. And like, this is the kind of care that we need. Not just me as a First Nation person, like all survivors. We need support in filling out our forms, not grief. Not, I can't do this today. That wasn't so bad. Like, I know it's bureaucracy and it's paperwork, but we need help to do that. It can be such a daunting process to go through ODSP, to get counseling, to get this, to get that. All these forms that we're required to do for all these organizations is daunting. And some of us aren't at the state where, we can cope with all these things. So we need providers and caregivers that are going to say, "Hey, how can I help you? What do you need?" So moving on to the accessing mental health. A lot of Indigenous people, First Nation status, don't know that they're entitled to counseling through their status. And knowing that they can access mental health through their non-insured health benefits, through their card, and how to look up a counselor, So they can receive up to 22 hours of counseling a year. And for myself, I think I was in counseling for 2 years, almost weekly. And I was assessed and, diagnosed. You can get additional hours if you need more support. Just for you, if you don't know this information, we've created an info card just for on our website for 60 Scoop survivors and First Nation people to know where they can get access counseling and what their rights are as a First Nation person. There's different services for Métis. Hi, just kidding. She's saying 5 minutes. Okay, so I'm like, I'm gonna rush through this. When I'm working with First Nation people, I always use the medicine wheel, and I address, am I meeting their emotional needs? What do they need? Am I meeting their spiritual needs? What do they need spiritually? Are they still going to church? If they believe in church, I support that. If they follow the culture, I support that. Sometimes we need reminding of what we need. So I don't assume that everybody follows the culture. I don't assume that everybody goes to church. I work with them and say, what are your beliefs? Do you practice culture? Did you eat today? Did you take your medication? Did you go for a walk? Things like that. And then mental. Are you seeing a psychiatrist? Are you seeing a therapist? Self-affirmations, things like that, right? Emotional. So I go through the medicine wheel with them and address each quadrant to make sure that all their needs are addressed during that phone call or during that session. And I don't really need to look at it anymore because it's just part of my own life too. My meeting my own emotional, spiritual, physical, and mental health needs daily. Sometimes we have gaps. We're not perfect people, but this is a guideline that I use to help my recovery and stay emotionally balanced. Culture saves lives. It saved my life. And I was at a point in my life where I was suicidal because I was missing something. But I didn't know what it was. It was like this big giant hole in my heart. And it wasn't until I started relearning ceremony and going to reconnect with culture that peace made me whole. And it's like for folks who may go to church or something like that, it provides some kind of belief and faith. And even in a big city like this, I was carrying a big bundle of tobacco this morning, and I carry it in my bra so I don't forget it. But just the simple act of holding it and praying and asking ancestors to help me get through today, to spread a message, to make sure my words are clear, and helps me help myself and helps you to help other survivors. So we need that connection to culture, and we need more effort supporting it. It saved my life, and it continues to save lives. This is my 5th national gathering. We brought over 600-700 survivors across Canada, as far as New Zealand, to Ottawa, to host cultural gatherings. For some people, it's the first time they're coming together to learn culture. And sometimes it's a jumping off point for them to start their healing journey. So I want you to know that we are healing, and we're going to be looking for supports, and I'm hoping that the knowledge I shared today, that you'll share it, that even if one person shares it within their circle and they share it, that's how we create change. So Miigwech, thank you very much. Any questions?
I recognize this may be a hard question, so if you don't feel comfortable responding, that's okay. I'm trying to learn more and help educate, my partner's family. I spend a lot of time with them. And they have a difficult time. Recently the Queen passed away, and I wanted to share that I had seen some memes about the Queen and colonialism. This person from my partner's family was talking about how wonderful she was, and the reaction I got was just, it's almost like I insulted her grandmother. And so I wanted to show an example, and she said, don't show me that. I don't want to see it. And then I immediately felt judged because she was saying, well, where are you seeing this content? Almost like I was looking for something dirty, or just inappropriate. And so what do you suggest so that we can have these kind of difficult conversations with people that we may not get to necessarily choose whether we spend Sunday dinner with.
Ooh, yes, that's a tough one. That is a tough question because it's in our workplace. We have folks that are that really adore the Queen, and then we're actually working a crisis line by people affected by the Queen. You know what I mean? Like it's kind of ironic, So it's a delicate situation, right? So some people are not ready to hear that. They don't want to hear that how the Queen has affected colonialism in Canada.
Yeah.
They don't see it, they don't know it because they've never heard of it before. So it sounds like you're bad-mouthing the Queen to them, right?
I just wanted to bring up something for discussion, and I was told by my partner that I should read The Room, and obviously his aunt adores the Queen.
Yeah,
So,
I'd say read The Room too. And because
how do we move forward?
Yeah.
Like, how do we have these discussions and take care of ourselves where, like, I don't leave feeling ashamed for wanting to have a difficult discussion that's affecting many people. I want to be an ally, but how do I take care of myself?
I mean, you could say what you need to say, right? And say, listen, this is what you believe, but I know different. And when you're ready to talk about it, I'm here, and I have information. Right. And people have a different experience of the Queen. Just tell them that your experience is different, or your adoration of her is very different from the Indigenous people who were colonized, and impacted by. So.
Yeah, that's helpful. Thank you.
Yeah. Okay.
The next panel is the legal panel, which seems somewhat appropriate given the speaker's keynote. Moderating this panel is Jan Marin. Jan practices with us at Gluckstein Lawyers. She focuses primarily on professional negligence and with a particular interest in medical malpractice and sexual assault litigation. She's a member of the Ontario Trial Lawyers Association Board of Directors and is on their interventions committee as well as litigator editorial board, practice direction committee, and the organization committee. She's an active writer in any outlaw matters, and she was also acting chair of other outlaw sections. She also volunteers once a quarter with Pro Bono Ontario, where she spends a full day out of her practice responding to hotline questions from low-income Ontarians, and I think that's an absolutely wonderful thing that, frankly, all lawyers should do. She also volunteers as team coach for Ontario Justice Network, bringing mooting to high school across the province. I'm sure that's fun. Sorry, she's also a board of director. She's on the board of directors for the Canadian Premature Babies Foundation, which brings her legal expertise for an organization dedicated to helping parents, clinicians, and educators who work with preemies. She is passionate and is a wonderful and dedicated advocate for her clients and families. She apparently enjoys practicing law, but when she doesn't, she travels with her family, spends time with her husband and her 2 children. We also have Mareki Newhouse. She's the Regional Sexual Violence Crown. That is a mouthful and a very daunting task, I would think. She's been a Crown prosecutor in the Toronto area since 2010, and she specializes in cases involving sexual violence and vulnerable victims, including child abuse and human trafficking cases. So pretty much your run-of-the-mill kind of Crown. She is presently a member of the Ministry of the Attorney General's Sexual Violence Advisory Committee and a small team of specialized prosecutors dedicated to enhancing the quality of sexual violence prosecutions and improving victims' experiences in the criminal justice system. Daunting task. And in addition to sexual assault prosecution, she also provides training and advice on sexual violence cases to police, Crown Counsel, and other justice participants across the country. Natasha Danson is a partner at Steinicke Macura LeBlanc. I probably got that wrong. Did I get it right? Okay. She advises and represents clients in all areas of professional regulation with a focus on matters related to discipline and sexual abuse. She also advises regulators and employment and human resource matters and has a particular interest in human rights. She volunteers as an amicus counsel to the Divisional Court for Pro Bono Ontario, and in addition to volunteering for the Pro Bono Ontario Legal Advice Hotline. She's a former member of the University Health Network Research and Ethics Board and the former editorial board member of the publication Health Law Canada. She has also gotten her law degree from Ottawa, which I recently visited and is a wonderful city. Dahlia Nicholson, she's the acting manager of the Ontario Ministry of the Attorney General. Not sure exactly what that means. Victim witness? Oh, okay, there we go. That makes a lot more sense. Okay. She's also team lead with the Victim Witness Assistance Program, which is an absolutely wonderful program. If you know about it, it helps with survivors who've gone through or who are going through the criminal justice system, and it has provided invaluable assistance to people. So she apparently she went to Carleton, great university.
Also in Ottawa.
Also in Ottawa.
For anyone who didn't hear what I said a minute ago, we're going to split the legal panel into two sections. We're going to start with the criminal and regulatory piece, and then we're going to switch gears and talk a little bit more about the civil side. So I wanted to start with Mariki. Most attendees will know what a traditional prosecutor does. But in terms of a specialized prosecutor, how has that been changing, the role of prosecutors? What work do you do with others to educate them in the sexual violence area?
Great question. So I'll start by saying we don't really have a whole lot of specialized prosecutors in our ministry, which is the Ministry of the Attorney General. I call myself specialized, but I'm not actually really specialized. I just have done a lot of sexual violence cases, and that's where my practice is focused. But for the most part, in your kind of an average sexual assault case, you're going to have a generalist prosecutor who prosecutes all sorts of things, from robberies, sexual assaults, to impaired driving cases, the whole gamut. So for the most part, there aren't really specialized prosecutors who prosecute these cases. We do have, I guess, a program, I could call it, for human trafficking cases. So human trafficking cases kind of come under their own umbrella. Because those are particularly kind of complex and difficult. So, you have to go through a certain kind of training to prosecute those cases. But otherwise, for sexual assault files, you're not generally going to be dealing with specialized prosecutors. What we do have, though, which I think is kind of nice and is unique to Ontario, is the group that I'm part of, which is the Sexual Violence Advisory Group. And we are 7 prosecutors in total. We work all through the province. And our job really is to help the frontline crowns, so the trial crowns who are in the trenches, as we say, every day, prosecuting cases, often overworked, sometimes under-resourced, but we're really there to help them out for any problems, any issues they might have in their files when they're working on a sexual assault case. So we have tons of papers that we publish for our crowns, and we're kind of like a 24/7 hotline for them when they come across an issue in their case. What do I do with this? Help! That's why we're there. So I think what's great about the model is it allows us to, our group has special expertise in this field, and we try to transmit that knowledge to our crowns, right? And that's, as far as survivors and how that might benefit them, I think they benefit from having really everyone take this trauma-informed approach, which is what we advocate from our group onto our trial crowns. And I think that really benefits everyone in the justice system, but particularly survivors, to have these crowns who are trained by us to adopt these approaches. So I guess to answer the question directly, although we don't have specialized prosecutors per se, we do have this specialized group that I think equips prosecutors to handle sexual assault files in a more capable manner and in a manner that's going to make things a little bit less difficult for victims and survivors. I won't say easy, because it's never going to be easy, and that's a fact, but perhaps less painful and less difficult.
Thank you. I want to turn to Dahlia now. In terms of the Victim Witness Program, if you could share what your role is within the criminal justice sector and what work you do to help survivors.
Okay, great, thank you. So I'll start off by just talking a little bit about the program itself. So the Victim Witness Assistance Program, we have offices in all the criminal courthouses across Ontario. and we take specific cases that are child abuse cases, domestic violence, and sexual assault cases. And our job, the frontline staff, is to deal specifically with those cases. So we reach out to the clients when there is a case of sexual assault, and speak with them about the court process. So what do they expect next? People have never been involved with the court process, so they don't understand the process. So our job is to give them information about the process, to walk them through the process from the time that a charge is laid by the police until the disposition of the case. So we are there to walk them through the process, as well as to assess what their needs are. So do they need counseling? So some people might say at this point no, but as we're walking through the process 2 years down the line, they might be ready for counseling, and so we make those referrals to counseling services for those clients. We work with the Crowns and the police in terms of setting up meetings if the matter is going to be resolved, or if the Crown wants to meet with the client because it's going to trial and they need to review their statement that they gave 2 years ago, then we set all those meetings up, and we sometimes sit with a client as they are testifying, because sometimes they might not have told a family member that they've been sexually assaulted and that they're going through a court process, and they don't have anyone there to support them. So we provide that on the ground support from the start of the case until the end of the case. And sometimes we have clients who maybe 6 months after things end might call and say, you know what, I wasn't ready for counseling back then. Can you provide me some resources? And we hook them up with those resources. And some clients, we actually have to do those three-way calls because they're just not in the space to reach out and do that for themselves. And it's not just about counseling, it's about their entire life. So we're also doing an assessment with them. What do they need at this point? So someone might have been sexually assaulted, they're in school, and they are not sure how to cope maybe with their professors or being in the same classroom with the person who was arrested and did this to them. So we might reach out and advocate with the university, with the professors, to say, can we change them into a different class? Can you maybe change their exam schedule? So it all depends on what the client needs. Our job is to figure out what are those needs and to find the resources to assist them as best as possible.
Thank you so much. Natasha, if you could explain for everyone what exactly it is you do with the regulatory colleges and what a survivor could expect in terms of making a complaint.
Okay, so I work at a law firm, and we act for different regulators. And a lot of the work that we do is for health regulators in the province. So in Ontario, most health professions are regulated under one umbrella piece of legislation, and they're all governed in much the same way. So think dentists, doctors, nurses, naturopaths, other allied health professionals. And all these health regulators have a mandate to eradicate sexual abuse among their membership. So a lot of our cases deal with sexual abuse or sexual assault claims by patients vis-a-vis their healthcare professionals. So where someone experiences sexual touching or remarks or any sort of sexual behavior while they're seeing a healthcare practitioner who's governed by a regulator, they can go to the regulator and make a complaint. And where they, and I think that was your question, right? What can we expect?
Yeah,
or what
and
can
the process as
complainant-
well.
Okay.
Yeah.
So if someone were to have a concern about sexual behavior, they could go to the regulator, make a complaint, and for the most part, those complaints are investigated unless it's clear that they're frivolous or they're not naming the practitioner, but sort of a standard sexual abuse case would start with a complaint. That complaint would be investigated by the regulator's screening committee. So that committee is set up to conduct investigations and then decide what to do with the particular complaint. So if someone comes forward as a complainant they could expect to file their complaint. There would be an intake process at the regulator. They would likely be participating in an investigation where questions would be asked to get more details about what occurred. And then ultimately, that complaint would be considered by the regulator's screening committee, which will look at all the evidence collected and decide on next steps. And those next steps can be, it can be to take no action. It can be to require that the healthcare professional take coursework or engage in some other remediation. Or another very common outcome in sexual abuse complaints is that the matter is sent to the regulator's discipline committee or tribunal, disciplinary tribunal, for a hearing. And where it goes for a hearing, so it happens before this discipline committee. The discipline committee is comprised of members of the public who have been appointed by the government to be a public voice on the discipline committee, and also members of the profession who have been appointed who adjudicate these sorts of cases. So someone can expect to go through that hearing process where they're meeting with the college prosecutor, and if it's a contested hearing, so the members contesting the allegations, they can expect to go through examinations, cross-examination. So it's the outcomes are different than the criminal process, but it's a civil process versus a criminal process, but it can look very similar just in that there is a hearing. And I think what's important to note is that the process can take a while, and regulators do have a duty to move cases forward quickly, but it still can take longer than people expect. And it's a difficult process because the underlying conduct is difficult, and then to go through it again or to go through the hearing process can be very stressful. But all these regulators have therapy or funding for therapy programs set up for people who complain about sexual abuse. So someone who complains about sexual abuse to a regulator about a regulated professional can receive up to $17,000 approximately that they can put toward, with some very limited exceptions, but they can use toward therapy to fix what's occurred. So
Can
that's
they
a
have
great
that
support.
at the stage of making the complaint, or does it require a finding at the disciplinary committee?
They have it right when they make a complaint, and that's a somewhat recent change, but there's no need for there to be a finding in order to qualify for the funding, and that is consistent with the regulator's mandate to really eradicate sexual abuse among health professionals.
Thank you. We've heard a lot today about trauma-informed approaches, and I'm wondering, from Ricky and Dahlia, in terms of dealing with this approach, using this approach in each of your practices, if you could tell us a little bit about what that means to you.
Sure. You want me to start? Sure. You know, I think for me, it really, using the trauma-informed approach allows me to interact with victims in a manner that really, it's all about understanding and compassion. That might sound a little bit cheesy, but you know, one of the things we learn a lot about in terms of the trauma-informed approach is the neurobiology of trauma. That's something that we've, I think a lot of justice system participants have been learning about. So what happens to the brain when undergoing a traumatic event, how what has happened during the trauma will affect how that event is recalled, how the trauma and what has happened to the brain during the event will affect how the person can talk about the event. And these are all things, like when I first learned these things, I was blown away. I had no idea about some of these things years ago. And I've been able to use them in my practice. So to give a concrete example, one of the things we learn about with the neurobiology of trauma is that when you go through a traumatic event, your higher brain functions kind of shut down and you go into survival mode. And forgive me if this is something that all of you know already, but you go into survival mode, and a lot of the time it's fight or flight, and there was some discussion just now, I know, of fight or flight. Often, frankly, the response is to freeze. That's what we see most commonly in the sexual assault context. So because of these sort of neurobiological processes, what happens is the person who's going through this event often remembers things in terms of like sensory fragments, right? So sights and sounds and smells. Does not remember them in terms of like a linear chronology which is normally what we do in court, right? Everything is so rational, and tell me what happened from A to B, and I want it linear, I want it chronological. So Crowns who don't have this training, which these days in Ontario is basically no Crowns because we all get this training, but if you don't know about trauma and how it affects the brain, and you're speaking with a victim or you're preparing, you know, your examination in chief of this victim, you might be asking questions in a way that is so unrealistic and unfair to her. Because if you're expecting a linear chronology, you're not going to get it. And you're just going to make her feel uncomfortable, and you're going to make her feel like she's doing this all wrong and like it's somehow her fault, when really there are ways that you can ask these same different questions to get at the truth of the matter in a way that is much more attuned to what she's been through. So instead of asking, tell me what happened from A to B, and tell me what part of him was on what part of you, and which hand did he use it, was it left or right? Like, who cares about those things? What were you feeling? Do you remember any particular smells? What were you thinking at the time? What was going through your mind? Do you remember any feelings in your body? So these are the kinds of questions that I will now ask of a victim when we're in court, and I'll prepare her for those kinds of questions when we meet prior to court. So there's kind of a concrete example of the trauma-informed approach, is kind of knowing how trauma affects a person, and how can I use that in my job to, again, make it less difficult for the victim to talk about what happened to her.
And so we use a trauma-informed perspective in terms of the information that we're giving a client. So the general principle is that you want to give the client a general information session and tell them all about the court process. But we know that when people have trauma, they're not going to retain all that information. So we know that we'll be having multiple conversation many times about the same things, and just being gentle and providing the information over and over and in different ways, again, so that we understand that sometimes this trauma that they had, maybe on the face of it, it doesn't look like, oh, it wasn't so bad kind of thing, but we don't know what other traumas had happened previously that now brings them in front of the court. So all of those things come together, so we have to work with each person individually to figure out what works for them. As well, we have to also think about when they're going to testify, what is best for them. So do they require a screen? Do they require a CCTV? Are they going to need multiple breaks? So also getting to know that person and how they function when they're recalling information. Again, victim witness, we don't talk to the client about what happened. We talk about how are you feeling about what happened? How are you dealing? What are your coping mechanisms? What are the things that work for you? What are some of the things that might trigger you? And so we try to figure out all those things so that we can better advocate with the Crown for whatever testimonial aid or how the case is going to go ahead, so that the client can be very well taken care of. And we also try to explain to client that it's not going to be an easy process. It might be a very difficult process, but we are here and we've created safeguards for them to be able to check in with us and to check in with themselves as they're going forward to testify. And then after they testify, it's brought up a whole bunch of things. It's like it's happening all over again, because the whole process of retelling the story means that they have to recreate it again in their mind in order to tell the court. So we do a lot of debriefing afterwards with the client to ensure that, again, that they've come down, they're in a safe space. And we also partner with our community partners to say, okay, this client's supposed to testify around this time. Can they set up an appointment afterwards so that they have extra debrief and supports to be able to assist them to, again, because we're interrupting their life. So it's been 2 years down the line most of the time, and we're re-interrupting their lives and asking them to bring this up again. So then we have to kind of figure out how do we have them move past that again. So it's a whole lot of everyday work with each one of our clients.
Thank you both so much. Natasha, if there's a survivor who's considering making a complaint to a regulator and also considering a criminal complaint, is there any preferred order that these things occur, or can they be done concurrently?
So technically they can be done concurrently, and often when someone comes forward with a sexual assault or abuse claim to the regulator, they'll go to the police at the same time. Practically speaking, though, oftentimes the regulator will wait where there's a parallel criminal proceeding. the regulator will wait on the outcome of that process before moving forward. Partly that's because if there's a criminal finding of sexual assault at the college level, the process becomes very straightforward. You just file proof of that conviction, and then it's over and done. If someone's found guilty criminally of sexually assaulting a client, a healthcare professional, they're, by definition, or like they will be found to have engaged in that conduct where there's a lower standard of proof at the regulator, which is not the criminal standard but the civil standard. So it's a lower threshold, and also it sort of spares the person, the complainant, from going through two processes at once, making inconsistent statements potentially, and oftentimes where there are criminal proceedings in place or that are happening, the person cannot practice the profession as part of the criminal process, and I'm blanking on the right word. It's a condition.
Yeah, like a bail
condition,
yeah.
right?
Yeah.
Or the regulator will impose an interim order, so they're taken out of the profession while the criminal process is happening at any rate. So the answer is yes, technically it could be at the same time, but often the regulator will hold back until the criminal process is done.
And I don't know, Enrique, if there's anything you would want to add to that at all from your perspective?
Yeah, just that I'm glad that that is the case, because often in criminal courts, the defense lawyers will want to pursue whatever else is out there, right? If there's a potential, other testimony of the victim in some other forum that they can access, they're going to access that, and they're going to use that to cross-examine the victim at our trial. So the more statements, the more evidence is out there floating around, the more we have to deal with more statements and more evidence and potential inconsistencies in court. And for the same reason, in fact, this is a bit off topic, but like there are some cases where a victim might want to go to the media, for example, and the case is still ongoing. I can't tell them what to do and what not to do, although there usually is a publication ban in place that complicates things. But what I'll often say is, listen, wait till this is done, because if you go out there and talk to the media, whatever you say is going to be used in court. And if you say something different, and we're human beings, usually when we tell a story or explain something, we don't explain it the exact same way every time. So there are going to be inconsistencies. So it just creates more complications. So it's the same thing where there's another proceeding happening. If we could just keep it as simple as possible, that's always best.
And I think that flows actually really nicely into my next question, which is about complainant credibility and what advice you provide complainants and survivors about this, and how you approach it in the courtroom.
Yeah. Credibility is such a tough thing. I mean, as a Crown, I always approach every case assuming that the victim is telling the truth and this is what happened. And it's not my job to judge his or her credibility or reliability, for that matter. That's going to be the judge's job. And Justice Wilson, I'm sure we'll talk about this at some point today, is how to determine, how do you decide if someone's credible? I think it's quite difficult, although I've never been asked to do it myself, but I would imagine, how do you determine it, right? So I can say, based on my observations in court and receiving judgments throughout my career, that inconsistencies are often a big problem in terms of undermining credibility. So if you've got a victim who's told the police that the sexual touching happened one way, and then she's come to court and described it differently, that could potentially be a problem. Often there's a really good explanation for inconsistencies. Often they're just apparent inconsistencies. They're not actual inconsistencies, but they can be problematic. So what I'll do to avoid inconsistencies, or at least to address inconsistencies, is I will try to prepare my witness or my victim and say, look, I've got this one statement where you said this, and then there's another statement where you said this. Be prepared to address that. I may ask you about it in my questions. The defense lawyer may ask you in his or her questions. So think about it. There's no right or wrong answer. You just need to tell the truth. But turn your mind to why you might have used a different word, or why you might have described it differently. And so she or he is prepared to do that on the stand. So I think major unexplained inconsistencies would be a problem for credibility in almost any case. Minor inconsistencies on peripheral details, like what day it was, what time it was, like who cares, right? Judges don't usually get hung up on those kinds of inconsistencies, but more major ones, if there isn't like a good explanation, those can pose challenges. Other sort of problems that can arise and that can lead to credibility being undermined, and I find this happens not infrequently, is People often feel embarrassed or ashamed or worried they're going to get in trouble about certain more peripheral things. For example, drug use, right? It's not entirely uncommon for illicit substances to be a part of the factual mix in these scenarios, right? You know, I did crack cocaine that night or whatever. And maybe she was worried about telling the police that because she was scared she'd get in trouble because it's illegal to possess crack cocaine. Maybe she kind of wanted to minimize it a little bit when she was in the witness box and didn't really talk about that. But yet we have the toxicological results from the hospital that show there was crack cocaine in her system. And now all of a sudden there's a lie there, or an omission, or something that can be seen as an attempt to mislead. So what I always say to victims and witnesses is, you know, there's nothing that you're going to say on the witness stand that's going to get you in trouble. You're actually protected legally from incriminating yourself. You can't incriminate yourself on the stand in criminal court. Anything you say won't be used against you in any kind of subsequent proceedings. So if you did smoke crack that night, or if you did something, no matter how, you know, horrible you think it is or embarrassing it is, don't shirk away from that. Don't minimize it. Don't undermine it. Come straight out with it. Just face it. We want 100% unfiltered truth. Don't overthink. Don't worry. Just answer the question directly, because any attempts to kind of strategize and, oh, maybe if I say it this way, then they won't know. Defense lawyers are very good at sniffing out witnesses' attempts to kind of avoid questions or minimize certain things, and they will sniff those out, and then all of a sudden something that started out as a minor, silly thing that has nothing to do with what actually happened, and yet the whole case unravels. Because guess what? If she was willing to sort of twist the truth on that point, then can we really believe anything at all that she said? So I would say, in terms of credibility, just being kind of 100% unfiltered and truthful. It sounds obvious, right? But it's people, even well-meaning people, sometimes want to fill in blanks or gaps in the evidence or sort of not get in trouble, and they say things, and it doesn't come from a bad place, but it can really unravel their credibility. So those are some tips that I give witnesses on what not to do in court.
I'm just noticing the time, so I want to end with the three of you with a question to Dahlia about a not guilty verdict and how you support survivors through that. Because I can imagine that can be very re-traumatizing for people. What do you do to support them?
So we do a number of things. So before the verdict comes down, or whether it's a verdict or a judgment comes down, we usually talk to the client. If it's not guilty, what are the supports that you have in place? If you don't have any supports in place, let us get some supports in place just in case something like that happens. So do we have a community worker? Are you coming to court that day? Is anyone coming with you? So we do a whole lot of planning just in case. And sometimes some clients are like, you know, I'm okay if it's a not guilty because I've moved on with my life, or it's going to be very difficult for me. Especially we think about, does the client have any issues with addiction? Have they been suicidal in the past? So we do a lot of planning around those kind of things to ensure that there are supports on the ground for the client. And it's funny that you asked that, because yesterday one of my staff had that same thing happen. The client, with clients not being on site as much anymore and everything happening via Zoom, we had spoken with the client, and the client said, okay, I'm fine, I'm not going to come to the office. When you get the results, just let me know. We had reached out to their community supports and said, you know, tomorrow around this time we might have an update. Are you able to be with the client? And it happened that she was able to be with the client. So when we called the client to tell the client's phone wasn't working, so we ended up calling the support person, and the support person said, yes, I'm here. So we were able to tell the client did have a very difficult time with that, and we ended up having to call in different supports like Gerstein Center and a bunch of different supports that we have in hand to assist the client. We spent maybe about 4 hours yesterday with that one client, trying to get her calmed down, make sure all her community supports were in place. And then this morning again, we reached out to the client. How are you doing? I'm doing much better. What are the plans for today? I have something set up with my therapist. I'm going to meet with that person. So it's client by client that we are able to do it, but it's really about knowing who the client is and knowing what potential supports they need and lining up those supports. And if you happen to not use them, that's great. If you need to use them, at least they're there in place for the client.
Thank you three so much for your expertise. I know there might be questions out there. Are you three going to be available at the end at all if people wanted to ask you questions later today? Fantastic. Okay, perfect.
I probably won't be, but you can find me on the internet.
Okay.
There is actually just one, there's one question right now if you want to take 1 second to, yeah, it just says, is it only the Crowns receive trauma-informed training? What about prosecutors in general?
Crowns and prosecutors to me are interchangeable in the criminal context, like all prosecutors are also known as crowns. And so in that sense, I would say yes, we all, in Ontario, I can't speak for other provinces, but in Ontario, I think we've been pretty good about ensuring that all of our crowns, including our newer crowns who've just joined, receive this kind of training on a regular basis. I can't speak for prosecutors at other levels. I'm talking just about sort of criminal prosecutors in Ontario.
Okay, thank you.
Thank you very much for that. And our next panel is our civil panel, and the panel includes Madam Justice Darla Wilson, who received her Bachelor of Arts from Queen's University, as she did also her Bachelor of Laws in 1984. She was admitted to the bar in 1986, and she was previously a partner with Lawson McGrenery here in Toronto, a defense firm mostly, and where she practiced exclusively in the area of civil litigation. She carried her practice throughout Ontario, defending hospitals and other healthcare facilities on negligence claims, general insurance defense work, including occupiers' liability, motor vehicle, municipal negligence, as well as also representing some plaintiffs in personal injury actions. Madam Justice Wilson is also an instructor in trial advocacy at the University of Toronto Law School, as well as a director of the Advocate Society and a board member of the Medical Legal Society. In 2007, she was appointed the Superior Court of Justice in Ontario, and from 2015 to 2017, she was the civil team leader for long trials in in Toronto. Madam Justice Wilson has been team lead for Toronto for Rule 7 motions since 2015, and she's also a member of the Moot Court Council at Queen's Law School. She is currently also on the board of directors of the Ontario Superior Court Judges Association. We also have Erin Ellis, who is a civil litigator with Jellinek Ellis Gluckstein, and she also received her Bachelor of Science from Cornell University, but then went to Queen's Law School and obtained her LLB in 2007. She was called to the bar in 2008. She has over a decade of experience and a proven track record of success advocating for sexual abuse survivors, both in recent cases as well as historical cases. She represents plaintiffs from across the country and sometimes even outside of Canada, and want acknowledgement and compensations for the harm perpetuated or facilitated by individuals and institutions, including abuse by teachers, coaches, relatives, foster parents, doctors, and clergy, just to name a few. Erin has a deep understanding of civil litigation, and her work, her extensive experience allows her to work effectively with clients and determine the best approach for each individual case. She is also passionate about representing survivors and uses compassion, dedication, and a strong advocacy skills to assist clients. She is overall an absolutely excellent lawyer. The last panelist we have is Kevin Heffernan, who is also a law clerk at Jellinek Ellis Gluckstein and has been with me for almost 2 decades now. Kevin graduated from the law clerk program back in 2004 at Humber College and joined me at my former firm, Jellinek Law Office, at that time. He helps out with the litigation representing survivors of sexual assault and childhood sexual abuse. He's worked with plaintiffs from all sorts of different cases, including Maple Leaf Gardens cases involving the Crown, Children's Aid Societies, lots of religious institutions, school boards, coaches, you name it, he's helped us. He's also represented claimants with the independent assessment process for survivors of the Aboriginal residential schools for Walpole First Nations, as well as representing claimants before the Criminal Injuries Compensation Board. Please come up.
Thank you for being part of the panel today on the civil side of things. And I want to start with Erin. Start right at the beginning. If a survivor is considering a civil action, what would you say they should know about the process?
I think that they should know everything about the process before stepping into the process. It's not an easy process. It's definitely not an enjoyable process. It can be prolonged. It is quite invasive. On the civil side of things, you're trying to prove liability, whether it happened, but you're also needing to prove your damages. To prove damages, as has already been talked about by Ivana earlier today, often medical records, therapy records, things like that have to be disclosed. That can feel very invasive. On the other side of the case, the defendants might include the actual perpetrator of the abuse. That person, if they're self-represented, might be able to read your therapy records, right? It can be a very invasive process, and I think that's not always the case. That's not always the case that the perpetrator is reading your records, but if that is going to be the case, they should know that up front, right? They should know how long civil actions can take. This isn't a quick turnaround. They should know that they'll have to go through examinations for discovery where they're questioned thoroughly about their lives, about the abuse, and especially in historical cases, your whole life is relevant. So these questions will be about your whole life. Other traumas that aren't the subject of the action can be asked about. You have to talk about them. You have to go through that. So I think they need to know what they're getting into. I think they also need to have realistic expectations of what a civil process can offer, which is, at the root of it, compensation, which is important. It's important to get that compensation to feel that your harms have been acknowledged, that you're believed, and hopefully some help with paying for the treatment that you're gonna need. But what someone on the street might think survivors should be awarded, it's not the realistic case in these cases. So survivors should understand before taking on this process what they're looking at by way of compensation. So have those expectations in line to know whether it's worth it for them to go through that process. And sometimes it's not. Sometimes the only defendant is that individual perpetrator and they don't have money. So then do you want to step into this process if at the end of the day you're going to get a piece of paper that says you're awarded this amount of money but you can't actually receive it, right? So I think they should know all that. But I think they should also know the pros, right? The good things about going through it. Yeah, get some compensation, get some treatment. Hopefully feel empowered. You're standing up for yourself. You're holding people accountable. People are believing you. People are advocating for you. So, and that's all part of the process. So I think they should have the full picture before deciding to take on a civil case. And then both the good and the bad. Informed decision.
Thanks, Erin. Turning to Justice Wilson, in terms of the judiciary's understanding of sexual assault and perhaps rape myths that have evolved over your time on the bench, how have you seen things change?
Well, I mean, I think I've seen them change more so in the criminal context, right? So when I started on the court 15 years ago, there was no judicial education with respect to things like rape myths and how to handle a sexual assault case or anything like that. And it was only, after some of the appellate courts made comments about the manner in which judges were handling these cases, the criminal cases, that it's now become mandatory for new judges to take specific training in criminal sexual assault cases, right? And so you have to do that in your first 5 years on the bench, and I think that's great, because of course people come to the court with a variety of experience, but it may well be that they've had no prior experience, with sexual assault cases, right? So I think that's an attempt by, the providers of judicial education to ensure that there is an understanding of these concepts. When you're first appointed and you go to what's called new judges school, and you're taught how to become a judge, there's you spend some time dealing with issues like, how do you make credibility findings, either in a criminal trial or in a civil trial? What do you look for? How do you make findings of fact? Those sorts of basic things. But I think, dealing with sexual assault cases, whether it's in the criminal context or the civil context, I think these are hard cases, actually, right? They're complicated cases, and so there is an educational process, I think, that goes on with the judge. And again, by the time the case wends its way through the judicial system and comes to me, I might see it, I might be case managing a case, of a civil sexual assault case. I've got a couple right now, but that's unusual. Generally speaking, I would see this case at the pretrial stage, right? And so that would be, a couple of months before the trial. And so you don't know who the pretrial judge is going to be if you're the counsel for the plaintiff, and you don't know who the trial judge is going to be. And so, depending on who it is, they may have zero background in these sorts of cases, right? And so, so there is, I think, a judicial, a component that counsel need to understand, that they may have to sort of educate the judge about these sorts of cases. It's great if you get, a counsel like Simona on a case, because I know that she knows what she's doing and she's an expert in the area. But don't forget that we see a whole variety of counsel of different abilities, and some of them, quite honestly, don't know how to put a civil sexual assault case together, right? And so that makes it tough for the trial judge. And of course, there's a limit in terms of what a trial judge can do, because it's up to the counsel to put the case before the court. So I guess the one thing I would say, I think that judges are more alive to these issues now, and I think that's a great thing, than they were, 15 years ago when I started out. But if you're counsel, I think that you should, have, available sort of case law or anything that you think might be able to assist the trial judge or the pretrial judge with how to approach these cases, how to assess these cases, that sort of thing. Because you might get a judge that's got, no background at all in these areas. Right?
That's helpful. Thank you so much. Erin, when should a survivor consult with a civil counsel?
I guess I would recommend, if they're able to, if they're ready to talk about their trauma, a good place to start is with a civil lawyer who's experienced in this area, who can give them all their options, right? So that's one of the first things we'll do when we hear from someone, is we go through their options. Have they done the criminal side of things yet? If they haven't, here's what that looks like for you. Here's the civil option. We used to be able to give them the Criminal Injury Compensation Board option, but that's gone now. So now it's those two options: do nothing, maybe get therapy, make sure that you're ready. But a civil lawyer, at least one that's familiar with this area, it's good to consult from the outside. That doesn't mean civil will be the first step in everyone's legal process, but a civil lawyer can hopefully lay out those options.
Thank you. Now turning to Kevin, if the client has made the decision to set up a meeting and come to their first appointment, what information and documentation is helpful for that client or potential client to bring to that first meeting? And what should they expect of the very first meeting?
The first meeting with the lawyer.
Yes.
Is what
And yourself, yeah.
And well, chances are I or Diana has already spoken to them at the intake over the phone, and we've already have a sense of what documents might be out there for them. So in terms of what they might have and in terms of what we're going to track down. So what would they bring at that first meeting? First of all, bring your ID. That's always a good place to start. We just want to make sure you're you and you've got the proper numbers that we're going to need down the line. A lot of people will say, well, if they have gone through a criminal trial or an administrative tribunal or something, they may say, I have all these documents from there. We don't need the whole wheelbarrow full of documents. Chances are we'll get to that. But for the first meeting, when you're going to be meeting with the lawyer, you're going to be going through telling your story again. You're going to be probably going into a little more detail than when we spoke to you on the phone. We know sort of what we're looking for, and we can track those things down with your help. We're going to provide you with a questionnaire beforehand, and we will work with you because, as we've heard today, some people are just not good with paper, or it's difficult for them to just bring themselves to push through an exercise like that and provide all this information. That's okay. We're there, we can help you. We can go over it with you on the phone or set up a meeting, however it's going to work best for you. And then we're going to, the clerks, the paralegals, are going to start drilling down and finding those documents that are going to fill in your trajectory, that are going to document your entire life, as we've heard again earlier today. Everything is pretty much relevant, from what you were like before to when this event happened and how it's affected you after. And things like contacting Dahlia. If you have gone through a criminal trial, she's going to have some documents that we're going to want. And we'll direct you back to her to say, hey, can we get a copy of that recognizance of bail or the information? And she knows what those mean, so don't worry. You say those words to her, she'll help you out. But essentially, we're going to build it up for you. Don't worry about it too much. We'll get you. Come by, bring your ID. We'll
we talked earlier today about survivor credibility. And from your perspective, Justice Wilson, how is that different for you in a civil sexual assault case versus what we heard earlier today from Reiki, from the prosecutor's perspective?
So credibility, is always an important issue in any trial, and a judge is going to have to make findings of credibility in most cases, right? And I think in the context of the civil sexual assault case, I thought the comments from the prosecutor on the last panel were really good. There are explanations for why people respond in the way that they do if they've been the victim of a sexual assault, right? And so I think from my perspective, I find the expert reports, and I've seen some terrific expert reports on these cases, very helpful in terms of explaining that sort of thing and explaining behavior. And so I guess one thing I would say, of course, a huge inconsistency is always going to be a problem in any case, regardless of whether it's a sexual assault or a medical negligence case or a motor vehicle case, whatever it is. And the judge is going to have to make credibility and reliability findings, right? And so things that are minor in nature or collateral in nature, and particularly in sexual assault cases that are not unusual responses to people who have been victimized, right? I think that I think the court is alive to those issues, and as I said, I think it's helpful to have expert evidence from, you know, people like psychologists and psychiatrists who deal with victims of sexual assault and sexual abuse on a regular basis. And you know, I've seen reports from Gail Robinson. I think she may have been a speaker today. I'm not sure, but I find her reports are terrific and of great value. But that's the sort of thing I think the court looks to try and assist us when we're making these findings. And again, you know, the lawyer has to prepare, you know, the plaintiff properly, whether it's for examination, for discovery, or for trial and cross-examination. And as some of the other speakers have said, you know, it's a difficult process for the victim to go through, right? It is not an easy thing. And you know, when you're under cross-examination in a civil case, you may have a lawyer that doesn't get it. There's a lot of education, I think, that needs to happen at the bar, right? I mean, we see these defense lawyers coming in and they treat these cases like they're just any case, right? Just, you know, like, you know, a slip and fall case or something, and I can cross-examine the same way. Well, actually, no, you can't. And so that's the sort of thing, I think, there has to be preparation, and the plaintiff needs to know, you know, you're going to be asked lots of questions that are uncomfortable and may seem unfair, and hopefully you've got a judge who's going to exercise, you know, a heavy hand with respect to propriety of cross-examination. But it's going to be a tough experience for sure, and I think if the victim, the plaintiff, is prepared properly and understands that, then I think they'll probably hold up better under cross-examination. But I've seen, you know, I guess I've seen some plaintiffs get in the stand and they have no idea what's coming down the pipe. And again, you know, there's a limit, I think, to what the trial judge can do, and we try to make sure that it's fair. But if the plaintiff hasn't been prepared properly, it's not going to be a good experience for them.
Thank you. Erin, I want to talk about, and perhaps we should start basic, and what a limitation period is, and if any apply to civil sexual assault matters.
Well, limitation period would be something, a time bar to when you can bring a claim, and there is no time bar for when you can bring a civil sexual assault claim. There used to be, although there were ways around it, hopefully. So we were still bringing historical claims before the change, but now we don't have to worry about it. As of 2016, the Limitations Act was amended to get rid of any limitation period for sexual abuse claims, which is good, because then we're not wasting our time arguing on that. We can focus on the case. And the reason they got rid of it was because of this increased awareness. Justice Wilson touched on this as well, kind of in that in more recent years, there's been more awareness of the impacts of sexual abuse. So the research has showed you shouldn't force people to come forward before they're ready. So if you have this time bar, you're forcing people to come forward before maybe they're able to talk about it, right? And so then you're causing them further trauma. So getting rid of that limitation period, letting people come forward on their own time, it's a more trauma-informed approach to law. And so it's been extremely beneficial to get rid of that. And it allows, you asked me earlier about when you can consult with civil counsel, and and in the panel before, it was you guys talked a little bit about what should come first, or can the admin go on at the same time as the criminal. When people come to me before a criminal process has gone on, and if they're interested in going with the criminal process, I always recommend that they do that first if they want to do it. If they're up for it, you don't have to. You can bring a civil case without going through the criminal process, but if you want to, I recommend that you do that first. There's no limitation period in the criminal realm either, but there's no limitation in civil, so we can wait. And we wait because, one, for some of those same reasons as the admin, if there's a conviction, then we're no longer arguing in the civil about whether or not it happened, right? It can streamline that civil approach. The other reason that I recommend waiting is because if at criminal, the burden of proof is higher. All they need to find is that reasonable doubt. So if you issue a statement of claim, a civil case at the same time, that's asking for a whole bunch of money. A criminal defense lawyer might use that to attack your credibility in the criminal case. Well, aren't you really making this up or exaggerating because you've started this $2 million lawsuit or whatever the lawsuit is, right? So we want to avoid impacting that criminal case at all. Same with the inconsistent statements. We don't want more statements on the record. If there's an acquittal in the criminal case, since the civil burden is lower, it's balance of probabilities, a criminal acquittal doesn't necessarily mean that you can't then bring a civil case. We have to see what those reasons are, and then we can make a recommendation whether or not you want to pursue that civil case. But again, that ties with the limitation period question, because it allows us that freedom and that time to kind of run these through, allowing the options for the survivor to take one at a time if they want to, and of course we recommend it.
Can I just add something there? Please remember that's no limitation period in civil in Ontario. If your claim originates in a different jurisdiction, you could be facing a limitation period. I don't know which ones offhand, but we're speaking strictly of claims that are originating in Ontario. There is no limitation period for sexual assaults claims there. And some of the lawyers here were partly responsible for removing that limitation. So I'm always proud to throw that fact out there too.
Definitely give Samantha some credit for that. We'd like to open it up as well to questions. I wanted to make sure we left some time for that. Does anyone have questions for any of the panelists? Charles?
Just going back to the previous panel and how it applies to civil cases, when you're using that trauma-informed approach to prepare for either direct evidence at trial or examination for discovery, and you use this sort of alternative to what happened from A to B in terms of the timeline, I presume the defense counsel in these cases are going to use that approach to, sort of attack the survivor's memory of the events. And if you're not doing it on direct, how are you preparing them for the cross that they're going to face in those cases?
So if I'm doing it in a more trauma-informed way, where I'm asking questions as opposed to trying to pin them down on the specifics, I mean, I think part of how I would handle that is the awareness, the expert reports, the explanations, the things that Justice Wilson touched on that would help a judge to understand why people might answer things in a certain way. So I think it's more, I can't object to them asking specific questions, but I can try and explain it by use of experts.
There's a couple questions that have come in online. The first question is for Justice Wilson. Someone saying that they work in the VAW GBV sector. Do family court judges have the same training as civil criminal judges? If you know.
So I can't comment on provincial court family judges. In the Superior Court where I sit, we have some jurisdictions, not Toronto, but I think almost all of the other ones, have a unified family court. And so those judges would have the same access to the judicial education courses that you can take about victims of sexual abuse and those sorts of things. And there are actually quite a few of them, you know, not just specifically in the criminal sexual assault context. So there is that education available in the Superior Court for all judges, including those who just sit in the family court.
Thank you so much. Now I left the big one for last because it's a difficult question to answer. And so I open it up to anyone who'd like to take a stab at this. So this is from, again, an online attendee. The process sounds like it's very difficult emotionally. What's the solution? How can we have a system that is way more sensitive and allows victims to go through a simpler process so that perpetrators can be held accountable? Just a simple question.
I feel like there have been books written about suggestions of having more trauma-informed approaches or change the law and change the process in cases of sexual abuse. It is tough because it's trying to fit these cases into a system that wasn't created for these cases. So there is no simple answer without, well, reform the system for sexual abuse survivors or abuse survivors, but that probably has its own issues with. The criminal system was built because it's important to have innocent until proven guilty because of its own pitfalls in that sense, right? So you always there's two sides to every story, so it's hard to create a whole new system.
I'll say changes at the court come very slowly and and here's something interesting, right? So, you know, in my capacity as the lead judge for civil trials and pretrials in Toronto, which, you know, has a huge volume of cases, there are very few civil sexual abuse cases that actually go to trial, right? Very few. Not a lot go to pretrial. I don't know why that is. I've wondered why that is, actually. I'm hoping it's because they settle at mediation, but I don't know that. And so from my perspective, you know, I think these cases are really, really important, and they're really complicated. And sometimes I think, I'm not sure that the defense side always understands it, let me put it that way. And so I guess what I would say, you know, is from my perspective, if there's a case that is coming down the pipe, it needs to be put together at an early stage, right? And I know there's no limitation here, and so sometimes these cases go on and on. And then I think you say, if you're getting stalled by things like obstructionist motions or counsel who don't want to deal with the case or just delay and that sort of thing, then I think maybe you ask for a case management judge, you know, to try and get a handle on it and to move it along and to ensure that it doesn't get bogged down in the nonsense, right? That it can get bogged down and so that it moves ahead so that it actually can be resolved at an earlier stage and not have to go through trial. These trials are horrible. They're horrible, and they're the last ditch effort if you can't resolve it, obviously, right? And so if that's necessary, then okay, it's necessary. That's what judges do, that's what lawyers do. But you know, 98% of our cases settle without the need of a trial, right? And so if you've got your case ready and you've got a judge who can deal with it and hopefully get it resolved, and then maybe the process isn't as negative for the plaintiff. I know it's an unfriendly process. I know it's really hard. And there's no guarantee that it's going to turn out okay in the end, right? So that makes it tough. But I do think if the case, you know, is ready and you can get it settled, at a pretrial or earlier than that, then maybe the process isn't as negative for the plaintiff, right?
I agree with that, and I also think some of the negative part of the process can come from unrealistic expectations of the process. So having experienced counsel who can explain from the beginning so that you have the expectations, you know what to expect, right? This is what an examination for discovery will look like. This is what a mediation will look like. This is the compensation we're talking about, so you're not extremely let down, right? And then do what you can during that process to make it more friendly. When we go to mediation, we typically, in almost, not 100%, but most mediations, we don't do openings, which is a typical way to start a mediation, where the plaintiff's lawyer makes an opening statement setting out their case, then the defense lawyer makes an opening statement setting out their case, going through all the weaknesses in the case, going through, in an abuse case, maybe the other traumas you face, to say, hey, this one wasn't so bad, or this is only worth this much, or you have these weaknesses. I don't believe survivors need to hear that from them. I need to tell them, right, as their lawyer, give them the realistic expectations, tell them, have frank discussions about the weaknesses of their case, but I can do it in a way where I already have a relationship with them. They don't need that beaten over their head in that process. So there are things in the civil litigation system that we have and that we have to work within that we can try to manipulate to try to make it an easier process to go through. Prepared, having your case put together, explaining things early, and then trying to get defense counsel to agree to certain things along the way that make it a bit friendlier. I think that's what we have right now.
Sure.
I also think that conferences like this help. Having different stakeholders, the awareness that brings into, as it bleeds out through different aspects of society, and educating defense counsel, and the awareness that this all brings for everyone involved in the process, whichever one you may choose, or whichever one is suitable, or whichever one you can access, is all going to help. We keep it on the table, we keep talking about it, we keep moving that boulder up that big hill, and you make little gains, as time goes on, they add up.
And they have, right? Awards have increased, understanding has increased. It happens slow, court changes happen slow, but they happen. And more people coming forward helps with that. More awareness, more talking.
Yeah, and I think, I guess from my perspective, I think if you're encountering difficulties and the case seems to be getting stalled or ground down with motions and that sort of thing, I do think having a case management judge involved stops that nonsense, and if you're facing a case where the defense doesn't really have an argument on liability, right? And so it's really just an assessment of damages. Then why isn't everybody focusing on what a reasonable settlement of the damages is, right? But sometimes it takes a judge's hand to get to that point, right? I've had pretrials where I've had, just wow, we don't believe this ever happened, and this, and this, and then when you actually start to, we're at the brink of trial, and so let's talk about evidence. We're not at a mediation; it's a different sort of process. And when you actually grind down on it, there is no evidence to support that position. And so I think that sometimes it is helpful, to have a judge involved to try to stop the blocks and get down to what really the issues in this lawsuit are about.
I'm just wondering if you could very briefly outline the circumstances and considerations that would make a victim choose a civil versus a criminal pathway, particularly for historical sexual abuse in childhood.
Yeah, sure. So, one, they don't have to choose one or the other. You can do both. Some might choose. We've had many clients who've decided they don't want to do the criminal process. A lot of that stems from their trauma, perhaps distrust of authority, and control, the lack of control in the criminal process. So in the criminal process, you go to the police station, you give your statement, and then it's somewhat out of your hands, right? The police are doing the investigation, the Crown decides whether or not, and then that process. You're now a witness, you're not a party, right? So you might choose to do the civil process because you're a party in that action. My job as your civil lawyer will be to give you my best legal advice, tell you the strengths, tell you your weaknesses, then you tell me what to do. You're the boss, right? Hopefully you're heeding the lawyer's advice and you're listening, but hopefully it's giving a survivor a sense of control of the process that they don't have in the criminal process, right? So in the civil process, they can hopefully feel empowered through that process, standing up for themselves through that process. But they might want to go criminal, they might want to do both. I think there's positive and empowerments that do come from the criminal process as well, but I do think some people choose not to do that process because of issues with authority, lack of control of that process, and that might be a deterrent.
Is there something you're looking for as a lawyer in either of those cases? Like, is there something that you are specifically looking for to make it worthwhile, apart from the victim's willingness?
In a civil case?
Well, in either, would you recommend it for or against, based on what criteria?
I think each case is so fact specific. There may be some people who reach out that I do say, if you're able to do criminal, that might be a better option for you to do first, because then the police will investigate perhaps more than my abilities to investigate. If you get the conviction there, it'll streamline this process. And sometimes that might be my advice when there's no institution attached that I can sue, so just an individual, because I don't want a long, drawn-out, expensive civil process where we're fighting about liability, fighting about whether or not it happened, because then it's eating into the assets of that defendant, and then is there an ability to pay at the end? So is it worth going through that civil process? So there are some situations where I never tell anyone they have to do criminal. I don't ever want to force someone to do that, but there are times where I say, if you're up for it, that process, going through that process might make your civil case that much stronger, and if you're up for it, that might be the better route to take. But you don't have to. And for whether or not I'll be able to recommend a civil option to someone, I'm usually looking at are they able to explain the process. But for whether I would recommend they do it, it's unfortunately at the end of the day it comes down to is there someone who will pay the compensation, because that's what I kind of touched on a bit earlier. It can be a very invasive, prolonged process. Do you want to go through that process if at the end of the day there's no compensation there, right? So I might recommend against them doing that process if it's going to be a whole bunch of fight, a whole bunch of upset in their life, whole bunch of here's a bunch of my documents, put me through examinations for discovery, and at the end of the day I get nothing, because then it's just re-victimizing, right? So in those cases I might steer someone away from the civil option.
And to add to what Erin said, that people might not realize this, number one, initial consultations with civil lawyers, no commitment at all. So you can call, have a discussion, and get the advice. And I encourage people to do that because we're available to you. And secondly, it doesn't cost money out of people's pockets to hire a civil lawyer. And it's important to know that. And having that call, then there can be discussion about how all of that works, but that can be a significant deterrent to potential clients not understanding that this isn't a process where they're going to have to outlay a lot of money to pay their lawyer.
Sorry, not the right one. To follow up. Institutional versus individual defendants.
Yeah.
apart from the assets available to institution versus individual, are there any other reasons you would choose to go against an individual versus the institution they represent?
If there's ever an institution I can link to the abuse, I'm going to sue them as well. That was, I think, my first day of tort law, first year university, was sue anyone you can who might have liability. Because then you get everyone to the table. If there's no liability, let them out after, but name them and see, right? So if there's ever an institution, I want them there. And the other institutions, it might be personal to them, but not as personal as the perpetrator themselves. So they often have experienced counsel who are experienced in this area. So that's an easier process for that civil case. Whereas individuals sometimes will retain criminal defense lawyers who don't understand the civil process, and that makes those cases much uglier. So institutions having experienced counsel on the other side, understanding the liability issues, being able to have those frank legal arguments is typically beneficial to my client, right? Because it'll streamline the case. It'll make it more about the real issues, and you're not getting caught up in other things. So yeah, that's all I can think of outside of obviously the pocket and the reason that you would want to sue an institution.
I would also add, in cases of historical abuse, that perpetrator may be dead. They might not exist anymore. You cannot sue the dead, so you're left with an institutional defendant.
You can't sue the dead
Thankfully.
after 2 years.
There's that limitation again. There we go. Always be aware of that.
You can't sue them if they've died the last 2 years.
Okay.
Oh, you can
That's right.
You can sue them if they've died the last 2 years. Then after that,
Their estate.
That's right.
You can sue their estate.
That's right. So I guess that is a limitation period that could arguably apply in these cases. Is if somebody dies, you have a limitation of how long you could sue that.
Well, I want to thank our panelists. All three of you have been great today. Thank you so much, and for the questions from the audience. Not always easy questions, so thank you three very, very much.
I just wanted to close up. We are out of time, so unfortunately we can't hear from Erin Ellis again with regards to her really interesting talk about domestic violence and sexual abuse. But we do have some slides available, and of course Erin is available if anybody does have any kinds of questions about that. It's a new tort. It's a really interesting tort, and it can apply in a lot of different situations. So please take a look at those slides, and if you have any questions, she will be available. For those of you online, thank you so much for your participation and the questions that we received. For those of you here, we have some wine and various little nibblies outside. And other non-alcoholic drinks. So please stay, have a drink. We're here, and if you have to go, then please go. I know there's childcare and all that other wonderful stuff. And there's going to be a video available of the meeting. Thank you so much.